What's up, everybody? Hey, what's going on, everybody? Welcome. Today is Monday. We're going to be going over NCLEX questions today. Sorry if my eyes are looking a little puffy, but allergies, man. Allergies. Hope everybody's doing well. Hope everybody had a good weekend, good, safe weekend. We're just going to wait for everybody to jump up in here, see how everything's going. And then once we get 100 people up in here, baby, we about to get it started. So once we get enough people up in here, we will get it started. So if you are new here, welcome. I want to know who you are, where you're from, where you're at in your nursing journey. We're about to do NCLEX questions. We do these Monday, Wednesday, and Fridays at 5:30-ish, depending on when I decide I want to get on. So make sure you guys smash the like button. Make sure you guys share. That way, people that way you let people know that I'm here. Obviously, I can't spell or talk. So make sure you guys make sure you guys share, make sure you guys follow. But share, let people know that I'm here. That way, they can get some good, some NCLEX, questions and knowledge and all that other good jazz. All right. So, hey, if you're new here, I want to know who you are, where you're from, where you're at in your nursing journey. I don't care if you just decided today, oh, Kevin, I want to be a nurse. Or if you're starting to do prereqs, if you're doing research, to what school you want to go to. Are you already in school? Are you about to graduate? You taking the NCLEX yet? You've been a nurse for however long you've been a nurse. I want all that talk. I want all those comments. I want all that conversation down in the conversation down here in the bottom. You never know. You never know who you're going to meet, and you never know who's going to impact you. So, don't be greedy your whole life. All right. Hi, I'm taking my NCLEX next week, but might push it back. I don't feel ready. Why don't you feel ready? So I'm telling you right now, the more that people try to push their NCLEX back, the more you deny the inevitable. Okay. So if you've given yourself 2 to 3 months, cool. But then I'm going to ask you, how you been studying? Have you been studying effectively? Is there something that you don't understand, truly understand? Are you just fucking lazy and you haven't been studying? Have you not been putting in the work? That's not directly geared towards you, but I'm just keeping it all the way real. So some people are just like that, just not studying enough. Fair. That's fair. If you're not studying enough and if you're not studying effectively, then yeah, I would recommend doing that. However, don't push it off. Don't push it off to where, it ends up becoming 3 or 4 months, and then all of a sudden you got to go take it, and then you don't do well, and then you start blaming yourself on why I didn't pass. Well, it's because maybe you were still studying, you weren't studying effectively, and now you kind of denied the inevitable because you were just trying to push it off. The test ain't going nowhere. The test is there. It's already written. Your story's already written in stone. It's however you're going to approach it and prepare for it. Okay. Is it Cheryl, 20-year nurse? Started as a CNA, LPN, now RN. Shout out to you, Cheryl. Queen Cheryl, shout out to you. Definitely not pushing it. Definitely not pushing and not putting in the work. Got you. And that's fair. You have to tell yourself that, right? Because I tell people all the time, they were like, well, what do you think I should do? And I was just like, well, the first thing is, what are you not doing? You have to put in the work. I already have my license. I failed my exam 3 times, y'all. 3. 1, 2, 3. And nobody would have ever known that unless I opened my mouth and said, hey, I failed my exam 3 times, right? But I've been a nurse for 3.5 years. I've worked in the ICU, I've worked in PACU, and I've worked in the OR. So you can't deny the inevitable, right? And don't think to yourself that you can't or you won't pass this exam, because you're going to think the same thing that millions of other nurses have thought, and those people still became nurses. So have you failed a class before? Absolutely. I failed a class and I had to retake it over. I failed so many tests in nursing school. I've had to take them over. So, specifically, I've never failed a class in nursing school, but I failed a lot of tests in nursing school. I failed classes when I was in my prereqs, but not specifically in nursing school. I almost failed fundamentals just because I was hard-headed. So, hey, we got 115 people up in here. I know y'all are done listening to me run my mouth. I'm going to turn this camera around. We're going to do some questions. I want you to make sure you guys participate. Hey, and by the way, I do coaching and mentoring and one-on-one coaching. If you want that, just let me know. That link is in my bio. So here we go. Hey, I do these commercial breaks every 5 to 10 questions, mostly every 5. So don't leave. I'm just saying, I'm here for you. Henry, you need a mentor? I got you. Check that link out in the bio. All right, Harry, here we go. A little bit of housekeeping rules. Participate. I'm funny, kind of sometimes, but whatever, however you feel. Hey, I don't know how to read. I don't know how to spell, and I don't know how to speak sometimes. So if you want to roast me on that, I'm all right with that. Just don't come in my chat and try to troll, because if you troll me, I'm gonna troll you, and then I'm gonna ban that ass. It literally says I'ma ban that ass. So don't be that person, all right? I don't gatekeep. I got these questions off of nurselabs.com. What's up, Joanna? nurselife.com. Make sure you guys go over there and check those questions out for yourself. Also, I have an NCLEX course I created pre-launch. It's for $48. Once you get it, you have it forever, and you get all the updates that I'm adding. So you can go over there and check that out. Link is in my bio. Also, if you're looking for one-on-one coaching, that's there too. What subject is this? This is just like a comprehensive, so it's all around, right? Passed my NCLEX on the 11th. Shout out to you. Hey, go give your, hey, everybody get, is it Coco? Everybody give Coco flowers. Let her know, hey, welcome to the shit show, the greatest shit show on earth, right? That's what we talk about. Well, welcome to being a nurse. Are you a RN or LPN? Because remember, LPNs and LVNs, y'all are nurses too. Don't let people come out here and try to disrespect y'all, because I'll never let them do it in front of me. You know what I'm saying? So congratulations to you. All right. So everybody make sure y'all give her some love. Okay. Here we go. Question number 1. When giving intravenous, phentoin, which of the following methods should be used? Is it use an inline filter, withhold other anticonvulsants, mix the drug with saline solution only, or flush the IV catheter with dextrose solution? What are we thinking? What are we thinking? And it's phenytoin. Gotcha. Okay, is it Caitlin? Caitlin says Amaya, you've been here before. I think I've seen your face and your name pop up many times. So I always say I haven't finished school. Oh, okay. I got you. Hey, so make sure you guys like, share, follow. Hey, smash that like button. Hey, don't be greedy. All right, smash the like button. All right, make sure you guys share, because you never know who's gonna need this. Okay, and I'm gonna put y'all on a stopwatch or a stop clock or whatever. So I'm gonna give y'all like 15 more seconds. All right. And also, if you're new here, I want to know who you are, where you're from, where you're at in your nursing journey. All right. Make sure you guys like, share, and follow. Do you always go live? This is my first time. Yes, I go live. Is that Vina? Yes, I go live every Monday, Wednesday, and Friday. Make sure you like, share, and make sure you follow. So then you hit that notification button so you know when I go live. All right. All right, y'all. Here we go. Here's our answer. Here is our answer. Once I get this together. Here we go. And 3, 2. And the answer is C. Mix the drug with saline solution only. Phenytoin is compatible only with saline solution. This question is part of, who it says, I'm new halfway through my accelerator program. Shout out to you, Kaylee. This question is part of physiological adaptation, which is the 3rd largest section on NCLEX, okay? So a lot of these drugs you can only mix with saline solution because of whatever other mixture compounds or chemicals that they have that can actually make it difficult and dilute medications to do what they're supposed to do, okay? So it says first-time viewer, first year nursing school, pharmacology now. Shout out to you. Pharm is huge. 2nd largest section on the NCLEX exam, all right? So here we go. My name is Sasha. I live in Orlando, currently moving to Texas soon. I'm an ER nurse and a psych nurse. Shout out to you, Sasha. I couldn't do psych because I'd be ready to fight, you know, so that's how it is. But, well, can't wait to see you when you get to Texas. Not like you come into my section, but you know what the deal is. Here we go. Question number 2. After a surgical repair of the hip, which of the following positions is best for the patient's legs and hips? Is it abduction, adduction, prone, or subluxate? Or subluxating. I'm just saying, hey, by the way, some of these words and some of these terms you're never going to say once you become a nurse. I'm telling you right now. I don't be walking around saying like, you know, subluxate. I don't say that. So, abduct. Okay. Got you, Liv. Like, is Liv short for Olivia? Like Liv Taylor? All right. I'm going to give y'all about 10 more seconds. Look, shout out to me. Look, I know the nicknames. You know what I'm saying? I know the nicknames. All right. Abda. HM1. What's up? All right, y'all. Here we go. Here's our answer. Here is our answer in 3, 2. And the answer is A. Abduction. Right? After surgical repair of the hip, keep the legs and hips abducted to stabilize the prosthesis of the acetabulum. There we go. See, I'm just saying, I enjoy these lives. I appreciate you being here. I'm glad you enjoy them. Hey, you let them know that I don't know how to speak and I don't know how to spell words, because do I look like a 10-year-old getting ready for a spelling bee? Absolutely not. You see me get broadcast on ESPN trying to win money? No, that's not how I do. Anyway, so physiological adaptation, 3rd largest section on the NCLEX, okay? Here we go. Octavia says, I'm a CNA student and I like this. Hey, shout out to you. I'm glad that you like it. Make sure you like, share, and follow. Here we go. Question number 3. Which of the following factors should be the primary focus of nursing management in a patient with acute pancreatitis. Is nutrition management, fluid and electrolyte balance, management of hypoglycemia, or pain control. Just Kitty says I'm an LPN student. It says where baby boo and what my wife cooking. Ma'am, Sasha. I don't know what she cooking tonight. Hey, but that boy been out of control. He in there doing something. I think he watching Paw Patrol or something. You know how you do. What's up, Sandy? I ain't seen that name pop up in a while. Joanna, I know I seen you up in here too. Don't think I forgot about you. All right, I'm gonna give y'all about 10 more seconds. All right, everybody saying C. Okay. All right, was on vacation. Should have stayed on vacation, girl. Shouldn't have came back. I'm gonna come get him soon. We can go out to eat. Hey, were you taking us out to eat? You know I'm down. All right, y'all. Here we go. Here's our answer. Here is our answer in 3, 2. And the answer is B, fluid and electrolyte balance. Acute pancreatitis is commonly associated with fluid isolation and accumulation of the bowel secondary to ileus and peripancreatic edema. Fluid and electrolyte loss from vomiting is a major concern. Therefore, your priority is to manage hypovolemia and restore electrolyte balances, right? Hey, so what's another way? What are some ways that you can get acute pancreatitis? Oh, there you go. Woo woo. Shout out to y'all. Appreciate the share. Make sure you guys follow as well. All right. Don't be greedy out here. Give me them love. Give me the love. Be my friend. Be cool with me. All right, binge drinking, right? Binge drinking. What else? Yep, alcohol. There you go. Hey, so just so y'all know, Steve Jobs, you know, the creator or the founder of Apple, he died from pancreatitis. So just saying, I'm just letting y'all know. Sometimes those things that you see out in the world can really correlate to what you're trying to learn. So when I found out about acute pancreatitis, that's one way that I remembered it. So, all right, here we go. Question number 4. After a liver biopsy, place the patient in which of the following positions? Left side, bed flat, right side, bed flat, left side with the bed in semi-Fowlers, or right side with the bed in semi-Fowlers? Lay the good look down. All right, Kat, I see you. All right, hey, if you guys are new, make sure you guys smash that like button. Make sure you guys share. Make sure you guys follow, all right? Hey, we're doing NCLEX questions. My name is Kevin. I've been a nurse for 3.5 years. You know, your boy's trying to do his thing, trying to teach, get his learn on. Your boy's going to school to get his master's in education because I like to teach. I'm going to give y'all 10 more seconds. All right? If you're new here, I want to know who you are, where you're from, where you're at in your nursing journey. Stir up a good conversation down here in the chat. Kat says C. All right, Kat, you ain't got to yell at me now. I see you, girl. All right, y'all, here we go. Here is our answer. We got some A's, we got some C's. Okay, we kind of all over the place, and that's okay. That's okay. No, you can't tell me to wait. Nope. It's too late. Answer's already locked in. I graduated in 60 days. Got my first job offer today. Shout out to you. It's A. Okay. All right, here we go, y'all. Here's our answer. In 3, 2. And the answer is B. Right side lying with the bed flat. Position the patient, I keep wanting to say client, y'all, so I'm sorry, but position the patient on his right side with the bed flat. Will splint the biopsy site and minimize bleeding. Hey, I don't know. Hey, remember, these aren't my questions, y'all. These aren't my questions. Liver is on the left side. That's dumb. I don't agree with that. Got the first one wrong. Hey, so here's the thing, is like out of 100 questions, even when you guys are studying for your NCLEX, like some of them are going to be wrong, and they're just going to be wrong. I don't appreciate some of these questions, so I'm just keeping it real. But hey, you got to think, what are we doing? We're doing a liver biopsy, right? So based off of the liver, right, what are we doing? Liver's where? There you go. Also in the fall semester, senior, pray for me. I ain't praying for you, girl. You got this. No, you got this. I'm just kidding. I'm a nurse and I got it wrong. It's okay. You're a nurse and you got it wrong, but think about it. How often are you thinking about this unless you do it all the time? Don't talk to me. Okay, I'll be quiet. All right, here we go, y'all. Question number 5. Which of the following potentially serious complications could occur with therapy for hypothyroidism? Is it acute hemolytic reaction, angina, or cardiac arrhythmias? Retinopathy, whatever you want to call it, or is it thrombocytopenia? What are we thinking? Is it Keisha? Kaisha? Kesha? Beep, beep, beep. I just got out of clinicals. You good, Kaylee? You good? I had to withdraw from my ADN program because got too overwhelmed and kept getting behind. That's where time management. That's where it comes into place. Like time management, and I'm telling you right now, like it's not just something that sticks with you while you are in nursing school. You do it as a nurse as well, right? So shout out to y'all. Appreciate it, man. We got 400 plus people up in here. Hey, shout out to y'all. Hey, if you're new here, make sure you like, make sure you share, make sure you follow. All right. Don't be greedy. Share it to other people. You never know. You never know who's going to need this. All right. And then follow me because I'm kind of cool sometimes. Just failed my NCLEX. I wish I found your page. Who is that? Is that Nona? Nona, why'd you fail your NCLEX? Tell us why. I'm telling you right now, anybody that fails their exam, it's your fault. All right. I'm going to give y'all 10 more seconds. We got B's. Okay. I think it's D. Okay. You think it's D. I got you. Can a neck CT show cancer? I don't know. Maybe. Possibly. If you have cancer in your neck. All right, here we go, y'all. Here we go. Here is our answer. Here is our answer. Let's get the answer. Hey, don't be rushing me. All right, here we go. In 3, 2. Appreciate the flowers. Thank you. And the answer is B, angina or cardiac arrhythmia. Precipitation of angina or cardiac arrhythmia is a potentially serious complication of hypothyroidism treatment. Yes, finally. Finally got something right, girl. That's what I'm talking about. All right, here we go. Here we go. Hey, reduction of risk management, right? One of the lower sections, probably about, I think it's 9 to 12% on the NCLEX, one of the smaller sections. However, it's still one of those sections that's very important. You can't forget about it because if anybody's ever failed the NCLEX, you guys will see on your breakdown, it'll tell you below, near, or above passing. All right. And you want to try to get it. Obviously, you want to get above passing on everything so you don't ever have to think about that again. Literally learned this today. Shout out to you. All right. Hey, real quick. We're doing NCLEX questions. Make sure you guys participate. Give me all them likes. Hey, make sure you guys share and follow. OK, don't be greedy. Don't troll my chat. If you troll my chat, I'm going to ban you. Nurselabs.com is where I got these questions. Also, check out the 7-day NCLEX course. Link is in my bio, as well as coaching is also in my bio. All right. Here we go. Question number 6. Adequate fluid replacement and vasopressin replacement are objectives of therapy for which of the following disease processes? All right, I don't know why this question's on there twice, but there you go. Is it diabetes mellitus, diabetes insipidus, diabetic ketoacidosis, or is it syndrome of inappropriate antidiuretic hormone secretion, or SIADH? What we looking for? Don't overthink or overwhelm yourself. Facts, right? I'm telling you right now, if you practice like you play, if you practice every day like you're taking the NCLEX, you'll get rid of your anxiety as well as your goal in sitting that NCLEX like you've been taking practice exams like you've been passing. Okay. We got D's, we got B's. Okay. This got to be B. It could be B. It could be. We're about to find out. Hey, if you guys are new here, we're doing NCLEX questions. Make sure you guys like, share, and follow. All right. Make sure everybody can see that. All right. Is it Ty? Thank you for the follow. La. Thank you for the follow. Don, Sam, appreciate the follow. Is it Bad and Bougie? Appreciate the follow. All right, y'all. I'm going to give y'all 5 seconds. Hey, like I said, practice like you play. Practice like you play. Time yourself when you're doing each question. 60 seconds. You want at least a minimum of 60 seconds per question, okay? When you're studying. All right, here we go. Here's our answer in 3, 2. And the answer is B, diabetes insipidus. Maintaining adequate fluid and replacing vasopressin are the main objectives in treating diabetes insipidus. That is part of, let's go. That is part of physiological adaptation. Remember, that is the third largest section on NCLEX, okay, at 14% of the entire exam. All right. Hey, so like I was saying, when you're studying questions, you at least 60 seconds, per question. Okay. 60 seconds between 90 seconds, no longer than 120 seconds. You get 5 hours to take this exam for both RN and LPN. Who's telling me to hurry up? Julianne, are you telling me to hurry up? I didn't realize we were on your time. You know, the good thing about a phone is you can take it wherever you want. Question number 7. Question number 7. Patients with type 1 diabetes mellitus may require which of the following changes to their daily routine during periods of infection? Is it no changes, less insulin, more insulin, or oral diabetic agents? C. Okay. All right, obviously C. Well, obviously, I guess, right? Bridget, thank you for the follow. A lot. Okay, mostly everybody's telling me C. Obviously C. I got you, user 2. You ain't got to tell me again. So obviously user 2 is telling me that it's C, and everybody else is telling me that it's C. Lauren, thank you for the follow. Appreciate the follow. All right, here we go. Mar says A. Okay, that's all right. Hi, where are you getting these questions? Nurselabs.com. That's where I got them. All right, y'all, here we go. Here's our answer, since it's probably obviously C, but let us find out here in a second. Here we go. Answer is C, more insulin. During periods of infection or illness, patients with type 1 diabetes may require more insulin to compensate for increased blood glucose, right? Because when you have an infection, your blood glucose goes up, so they need more insulin to regulate that when they get sick. All right? Yup. Shout out. Hey, physiological adaptation, third largest section on NCLEX, right? This is why it's important for you to read your rationales. Make sure you read your rationales, right, on why you got it wrong. But then also, if you got it wrong, why these are incorrect and why that one's the right answer, okay? All right, here we go. Samantha, thank you for the follow. Question number 8, on a follow-up visit, after having a vaginal hysterectomy, a 32-year-old patient has a decreased hematocrit level. Which of the following complications does this suggest? Is it a hematoma, hypovolemia, infection, or pulmonary embolism? What are we thinking? What are we thinking? Hey, sometimes if I can't see your questions because there's so many of y'all can answer each other's questions. That's cool. I see y'all down there doing that. So I appreciate y'all. If y'all are new here, make sure you like, share, and follow. Hey, like, share, and follow, all right? Hey, if you're new here, I want to know who you are, where you're from, where you're at in your nursing journey, okay? I don't care if you're a brand new nursing student, if you're in prereqs, I don't care. I want to know. Let's foster a good little conversation down here in the chat while people are answering. 10 seconds, y'all. Trace, thanks for the follow. 4 people. Lily, thoughts, thank you for the follow. Is it Aris? Thank you for the follow. All right, y'all, here we go. Is it Bria? Thank you for the follow. Yo, I'm from Alabama, first semester. Shout out to you. I'm glad you found me, or I'm glad I found you, whatever. Here we go. I'm an ICU nurse. Sorry, I lost it. Here we go. And the answer is A, a hematoma, right? A decreased hematocrit level is a sign of hematoma, a delayed complication of abdominal and vaginal hysterectomies, right? Hematoma is more common, I guess. Yeah. Just finished my prereq. Shout out to you. I wish I could afford nursing school. Who said that you can't afford nursing school? There's tons of programs that are out there to where you can go to nursing school. I promise you that, right? I'm not a big person. I'm not a big believer in doing loans, but I mean, you come out here and you move through the nursing career, right? You can pay those loans back super fast. So, all right. So think about that. Here we go. Question number 9. Shout out to all 600 of y'all up in here. Make sure you guys like, share, follow. We're doing NCLEX questions. A patient with partial thickness burns to both legs and portions of his trunk. Which of the following IV fluids are given first? Is it albumin, D5W, lactated ringers, or 0.9% sodium chloride with 2 milliequivalents of potassium per 100 mLs? Everybody screaming C. Thank you for the share, Cali Girl. Never heard of these options before. So when you start to get to IV fluids and fluid and electrolytes and stuff like that, when you start to get to that portion in your class, you'll learn a lot about the IV fluids. You know, your isotonic, your and hypertonic and hypotonic salines and stuff, or solutions. Sorry. So you'll learn a lot about that once you start to get further through your program. All right. All right, we got D's, we got C's. 15 seconds. I mean payment for school. Well, like I said, there's tons of programs out here that you can go to, that you can, apply for nursing school. There's programs out here that'll pay for you to go to nursing school, but you're required to, go work where they want you to work. I say D. All right, KB, I got you. I can't even. It's C. Okay, got you. Juan says it's D. Carmen says it's D. And jobs that pay, for sure. Yep. So you could go be a CNA and work at a hospital, and they offer to pay for you to go to school as well. So here we go. Here's our answer, y'all. Here is our answer in 3, 2. I will be attending nursing school in January. Shout out to you. And the answer is C, lactated ringer solutions. Lactated ringer solutions replace lost sodium and correct metabolic acidosis, both of which commonly occur following a burn. Yeah, no says yes. That's what I'm talking about. I ain't say I didn't believe you now. I ain't say I didn't believe you. You know what I mean? So is this for LVNs? This is for all nurses, LVNs and RNs. All right. Pharmacology, second largest section on the exam. Okay. Second largest section on the exam. Hey, All right, here we go. Question number 2. If you're a single mom and you don't go to free, if your ex-husband makes a lot, they tell you to ask. I don't even know what that means. Use Ring of Fire to remember. Hey, there you go. That's a good one, Jessica, to remember. All right, here we go. Which of the following techniques is correct for obtaining a wound culture specimen from a surgical site? Is it A, thoroughly irrigate the wound before collecting the specimen? Use a sterile swab and wipe the crusty area around the outside of the wound. Gently roll a sterile swab from the center of the wound outward to collect drainage. Or is it D, use a sterile swab to collect drainage from the dressing? All right. See again. Okay. I can't even deal with you. Okay. No, I'm just playing. You good. Hey, if you guys are new here, welcome. Shout out to all 400 plus of y'all in here. Make sure you guys like, share, follow, smash that like button. How often do I do lives? Every Monday, Wednesday, Friday, 5:30 Central Standard Time. How do I get help with what website? What you talking about? Appreciate the follows. Thank you. You're welcome. C, always inside to out. I'm sorry, C. All right. I got you, Milky. That felt weird to say, but whatever. So happy I found your page. Danielle, I'm so happy you found it too. We do these 3 times a week. All right. I'm gonna give y'all 10 seconds. I'm using nurselabs.com. How do I remember what I learned in school? Repetition. All right, here we go, y'all. Here we go. Here's our answer. You're welcome, can't even. Here's our answer in 3, 2. And the answer is C. Gently roll a sterile swab from the center of the wound outward to collect drainage. Rolling a swab from the center outward is the right way to obtain a culture, a specimen from the wound. And that's part of health promotions and maintenance. The reason why you want to start at the center is because that's where all the nasties is happening, right? You want to get it from the most nasty to the least nasty, but the most nasties you already got up inside there. You know what I'm saying? And then, of course, you don't ever want to start a round of antibiotics until you've gotten a culture, right? So that's usually how it goes, especially when you start working on the floor. Look at us in here killing it. That's what I'm talking about. Shout out to y'all. Hey, real quick, we're doing NCLEX questions. Like I said, I got these questions off nurselabs.com. Go check those out for yourself. Participate. Give me them likes. Somebody just give me a bunch of flowers. Alex, I appreciate you. Like I said, give me them likes. Don't troll my chat. You come in here and troll me, I'm going to troll you. And then I'm going to ban that ass. And then I'm going to make fun of you. And I don't care. Here we go. 7-day NCLEX course. It's a course I created. Check it out. Link is in the bio. For $48, you get it forever, yo. For a lifetime. However long your life is. Just don't drink and get pancreatitis. Anyways, and if you need one-on-one coaching for NCLEX, you can check that out. Book a 15-minute free call with me. That link is also in my bio. Here we go. Lillard just went over critical care lectures, pain management, and burns. This is a great review. I'm glad this is super helpful for you. All right, here we go. Question 11. A nurse is administering IV furosemide to a patient admitted with congestive heart failure. After the infusion, which of the following symptoms is not expected, right? So what, I'm scared now at this point, like, whoa, like that ain't supposed to happen. So what is not expected? Is it an increased urinary output, decreased edema, decreased pain, or decreased blood pressure? We got C's, we got D's, we got some A's. Somebody said A up in here. Hey, shout out to all 400, 500 of y'all. Make sure you guys like, make sure you guys share, make sure you guys follow. Don't be greedy your whole life, all right? Make sure you guys let them know that we're doing this right now. We do this for about 2 hours, by the way. 15 seconds, y'all. If you're new here, I want to know who you are, where you're from, where you're at in your nursing journey. I don't care if you're a prereq student. I don't care if you've been a nurse for 40 years. Let us know. I get a lot of nurses that have been here 20, 30, 40 years. So shout out to y'all for paving the way for folks like us. All right, here we go, y'all. Here we go. Alexis in your first semester, new grad, Lisette, shout out to you. All right, y'all, here we go. Here we go. Here's our answer. Here's our answer in 3, 2. Occupational nurse. Oh, shit, I need your job. Chamberlain. All right, here we go. And the answer is C, decreased pain. Furosemide, a loop diuretic, does not alter pain. However, does decrease that blood pressure, does increase urine, right? You got to know radiation oncology. Hey, shout out to all my cancer nurses out there, for real. Like y'all, I'm telling you, y'all are a special breed. Y'all are a lot better than me. I had one cancer patient while I was working in the ICU, and that was tough. That was a tough one. So shout out to y'all for doing it every day. And I love all my nurses. Hey, if I got any CNAs, if I got my LPNs, my MAs, my occupational therapists, my PTs, my respiratory therapists, look, I love y'all. I'm telling y'all right now, I love every single one of y'all. Cardiac nurse educator. Oh, you're my friend. I want to be your friend. All about the education. Shout out to you, sir. All right, here we go. There are a number of risk factors associated with coronary artery disease. Which of the following is a modifiable, keyword, modifiable risk factor? Gender, age, obesity, or hereditary? Currently getting my BSN, working in oncology. Shout out to you. Hey, if you guys are new here, make sure you guys like, share, follow. My name's Kevin. Been a nurse for 3.5 years. Worked in the ICU, worked in OR, worked in PACU. Been cool. You know, your boy's going to get his master's in education because I love to teach. That's why I do this. So shout out to y'all. Appreciate all the follows. Y'all out here killing it. All right, I'm gonna give y'all 10 more seconds. I'm thinking about ICU. Do it. Don't think about it. Do it. Why are these so easy? NCLEX was nothing like this. Some of these questions are easy. Some of them are not. Hey, these aren't my questions, by the way. I'm just letting you know. Change B. Okay. You got to give me one. I quit nursing school. Why, Lori? Why'd you quit? I quit the ICU. NCLEX is easy. That's debatable. Depends on who it is. Here we go. Here's our answer, y'all. Here's our answer in 3, 2. And the answer is C, obesity. Obesity is an important risk factor for coronary artery disease that can be modified by improved diet and weight loss, right? Is this next gen? So I'm going to say something about next gen. Next gen, the biggest thing about next gen is the way that the questions are delivered to you. That's it. NCLEX next week. Mag, you got it. Shout out to you. That's all. That's all that's different is that how the questions are delivered to you. And they give you partial credit, right? So, but the content that you learn while you're studying for NCLEX and while you're in school hasn't changed. Hasn't changed at all. I'm just letting you know. Here we go. Question number 13. Sorry if you guys hear my co-host back there. He's screaming. I don't know what his problem is. But TPA is considered for the treatment of a patient who arrived in the emergency department following the onset of symptoms of myocardial infarction. Which of the following is a contraindication for treatment with TPA? Is it worsening chest pain that begins earlier in the evening, a history of cerebral hemorrhage, a history of prior myocardial infarction, or hypertension? Currently working on my DNP. Shout out to you. Is it Jacob? Shout out to you. What you getting your DNP in? I'm gonna give y'all 25 seconds. Got B, Liv, and Lovi. Appreciate it. How much studying do you recommend your first year of nursing school? You need to study a lot because you're taking somebody who knows nothing about nursing and take a family nurse practitioner. Shout out to you. Oh, DNP and family. Okay, I got you. But yeah, you got to study a lot. You got to get into the rhythm. CNA, hopefully become CRNA. Hey, shout out to you. That's a long journey, but you, just like everybody else, you can make it. 10 seconds. All right, here we go. Aiming for general. Okay, general, got you. Find a study group in school with. Yep, let them know, Mickey. Y'all let them know. Here we go, y'all. Here's our answer. Jesse, I'm glad you found it. Here we go in 3, 2. And the answer is B, history of cerebral hemorrhage. A history of cerebral hemorrhage is a contraindication to TPA because it may increase the risk of bleeding. TPA acts by dissolving the clot, blocking the coronary artery, and works best when administering within 6 hours of onset of symptoms. That is part of physiological adaptation, which is the third largest section on NCLEX, okay? As well as physiological adaptation really consists of like acute care, chronic care, trauma, stuff like that. So you got to think like somebody who's coming into your ER and they're displaying a myocardial infarction, like what is the very first things that we're going to do for them, right? And remember, on NCLEX, you have everyone, you have everything, okay? Currently in nursing school prereq, starting nursing school in 1 year. Shout out to you. All right, here we go. Question number 14. Following myocardial infarction, a hospitalized patient is encouraged to practice frequent leg exercises and ambulate in the hallway as directed by his physician. Which of the following choices reflects the purpose of exercise for this patient? Increases fitness and prevents further heart attacks? Is it prevent bed sores, prevent DVTs, or prevent constipation? Hey, some of these, I just want to let you know, some of these are right, but which one is more right? That's what you're going to hear. That's what you're going to hear. And the thing about it, I'm a big content person. If you don't know content, you're not going to be able to apply them. Some people are just like, yo, this is really easy. Well, you have a good understanding of content and you understand how the disease process works. Some people in here have not even seen questions like this. All right. So you guys got to be aware of the audience that is in here. OK, so some people select all that apply. No, this ain't one of those. This ain't one of those. 10 seconds. 10 seconds, y'all. Shout out to y'all. Hey, if you guys are new here, I want to know who you are, where you're from, where you're at in your nursing journey. Who said something about TPA given in 4 hours? TPA wasn't given or isn't given if over 4 hours of onset. I don't disagree with you, neuro ICU nurse or neuro nurse. However, you got to remember is that on NCLEX, everything is a standard. So based off of what they say, then it differs from hospital policy to hospital policy, and then based off of whatever echelon of higher learning as well. I'm not saying that you're wrong. All right, here we go. Here's our answer in 3, 2. And our answer is C, prevent DVTs. Remember, what is the most important thing, right? Getting up and exercising, does it prevent bed sores? Yes. Getting up and exercising, does it prevent constipation? Yes. But what is the most important thing I'm thinking about, right? Is DVTs. Exercise is important for all hospitalized patients to prevent DVT or deep vein thrombosis. Muscular contraction promotes venous return and prevents homeostasis to the lower extremities. All right. So you got to think about it that way. I thought they do case studies on the NCLEX nowadays. They do. However, with case studies make up anywhere from 30 to 40%, or I'm sorry, the new gen makes up 30, 40%, meaning just to how the questions are delivered. But your select all that apply, they ain't going nowhere. They still there. Trust and believe me when I tell you that. Your multiple choice, which makes up the majority of your exam, they're still there. So you will still get questions like this. I promise you will still get questions like this. You did oncology, hospice, now you do peds, now you're working with the little folks. That's what I'm talking about. All right, here we go. Question number 15. A patient arrives in the emergency department with symptoms of myocardial infarction progressing to cardiogenic shock. Which of the following symptoms should the nurse expect the patient to exhibit with cardiogenic shock? Is it hypertension, bradycardia, bounding pulse, or confusion? You graduated in December. Shout out to you, Lizzie. I'm sorry. Shout out to all 600 of y'all up in here. Appreciate y'all rocking with me. 15 weeks left. Shout out to you. I want to know who you are, where you're from, where you're at in your nursing journey. All right. Make sure you guys smash that like button. Make sure you guys share and make sure you guys follow. I do these 3 times a week, Monday, Wednesday, Friday at 17:30 Central Standard Time, Texas time, because that's the only time that matters. 10 seconds. Taking my NCLEX soon. Shout out to you. Abby says B. Okay. D, maybe. Okay. I would rather you guess than not give me an answer at all, because you're going to find out what the answer is. And then that is how you learn. You're awesome. Would you say thank you for taking the time to help? I love doing this. Hey, y'all, I failed my NCLEX 3 times. Y'all. Yeah, you heard me right. I'll tell y'all about that here in a second. Here we go. Answer in 3, 2. And the answer is D. Confusion. Cardiogenic shock severely impairs the pumping function of the heart muscle, causing diminished blood flow to the organs of the body. This results in diminished brain function and confusion, as well as hypotension, tachycardia, and weak pulse. Cardiogenic shock is a serious complication of myocardial infarction with a high mortality rate. Yes, second semester here. Shout out to you. No perfusion to the brain, no perfusion, no oxygen, no nothing. It's going to start getting your heart's going to start acting weird. Your cardiac nurse, shout out to you, Glenda. I know another Glenda. You're the second one I've ever known, I guess, in my life. So shout out to y'all. But yeah, I don't even know what I was talking about in regards to NCLEX. So, oh yeah. So like the questions haven't necessarily changed. It's all about how they're being delivered. Okay. Physiological adaptation, the third largest section. Oh yeah. I failed the NCLEX 3 times, y'all. 3 times. And y'all would have never known that unless I told y'all. But hey, commercial break. Participate. I'm kind of funny sometimes. Give me them likes. Give them all to me. Don't troll my chat or I'm going to ban that ass. Nurselabs.com is where I got these questions. I keep getting that question. So that's where I got it from. Okay. And then 7-day NCLEX course. That's a course that I created because I failed the exam and I don't ever want people to feel that way. And so I try to provide, what helped me the best. $48. It's yours for a lifetime for right now. Also, if you need NCLEX coaching, I do one-on-one coaching. Get your 15-minute call. Check that out. That link is also in my bio. All right, here we go. Question 16. Shout out to all 600 of y'all. I want to know who you are, where you're from, where you're at in your nursing journey, as well as smash that like button, share, and follow. Don't be greedy your whole life. You feel me? So here we go. A patient with a history of congestive heart failure arrives at the clinic complaining of dyspnea. Which of the following actions is the first the nurse should perform? So what is the very first thing that I should do? Right? Ask the patient to lie down on the exam table, draw blood for chemistry panel and arterial blood gas, send the patient to chest x-ray or check blood pressure. A, B, C, easy as 1, 2, 3. Assess first, right? Do I have enough to implement, right? You got to always think. For all my first year nursing students, I want you guys to think about that. Think about ADPI. That's never going to go away. Cora says, hey, I got you. Hey, ADPI, assessing, implementing, thinking about Maslow's physical versus psychosocial, thinking about our ABCs, level of consciousness with our ABCs, right? I'm also a trauma nurse instructor. So you got to think about that level of consciousness in ABCs, right? A through J, as we call it. That's a different algorithm. But I'm going to give y'all 10 more seconds. All right, we got some A's. We got some D's. I love this. Elizabeth, I'm glad. All right, here we go. Second semester. Shout out to y'all. All right, y'all. Here we go. Here is our answer. Here is our answer in 3, 2. And the answer is D. Of course, check that blood pressure. A patient with congestive heart failure and dyspnea may have pulmonary edema, which can cause severe hypertension. Therefore, taking the patient's blood pressure should be the very first action that you should do, right? It says, I would think O2, but that's not a choice. You're right. That's not a choice. Don't give the question more. Don't say what ifs, because as soon as you say what ifs, you're going to change your answer. You're going to really contradict yourself, and then you're going to get the answer wrong. All right. So don't do that. Okay. Don't do that to yourself. Please stop doing these. I graduated in May. You want me to stop doing these? Hey, you can leave. I'm just saying. But you good. You graduate soon. Hey, the hardest part about nursing school is getting through it. I promise you. The NCLEX is just that a few steps of getting past that finish line in that portion of the journey. I promise you. All right, here we go. Question 17. A clinic patient has recently been prescribed nitroglycerin for treatment of angina. He calls the nurse complaining of frequent headaches. Which of the following responses to the patient is correct? Stop taking the nitroglycerin and see if the headache improves. Go to the emergency department to be checked because nitroglycerin can cause bleeding in the brain. Is it headaches are frequent side effects of nitroglycerin because it causes vasodilation? The headaches are unlikely to be related to the nitroglycerin. So you should see your doctor for further evaluation. Somebody said, C, I take nitro. That's cheating. Okay. Chrissy, that's cheating. Okay. You can't answer. No, I'm just playing. I failed my PN 3 times. I failed my NCLEX RN 3 times, y'all. And no part of me cares that I told y'all that. And no part of me cares when people tell me that I was a shitty nurse. And I was just like, hey, bro, your opinion of me has nothing to fucking do with me. Just letting you know. We'd say headaches are expected. You also got to know what the expected outcomes are for these medications that we give. Like, what should I expect when I give furosemide, like we talked about earlier, right? Did you go over the T's? No, I don't go over the T's. I don't do T's and I don't do HESI either. I know a lot of people ask me that, but just saying. All right, y'all. 5 seconds. 5 seconds. Here we go. Really appreciate you sharing. I'm really struggling on the exam and I have poor HESI scores. That's okay. You do nothing but improve from here. All right, here we go. Here's our answer in 3, 2, and the answer is C. Headaches are a frequent side effect of nitroglycerin because it causes vasodilation. Nitroglycerin is a potent vasodilator and often produces unwanted side effects such as headache, dizziness, and hypotension because what? It vasodilates. Patients should be counseled and the dose titrated to minimize these side effects. In spite of the side effects, nitroglycerin is effective in reducing myocardial oxygen consumption and increasing blood flow. Okay? Hey, pharmacology is the second largest section on the NCLEX, okay? It goes management of care, pharm, and then physiological adaptation, all right? So I need for y'all that needs to stick in your head. It needs to stay there, okay? Think about that. All right, here we go. Question number 18. I had an instructor tell me that if you don't score high on the T's, you will fail past first try. I don't know why. Some people are just fucking negative and negative Nancy's, and they do that. They do that to try to weed you out and to psych you out. In reality, everybody has a standard. It's a fucking racket. I'll be completely honest. That's just me. That's my thought process. Don't be scared of it. Understand the battle plan once you go forward. Okay. That way, you know how to conquer that shit. I'm telling you right now. Here we go. Question number 18. A patient received surgery and chemotherapy for colon cancer, completing therapy 3 months previously, and she is now in remission. Shout out to her. At a follow-up appointment, she complains of fatigue following activity and difficulty with concentration at her weekly bridge games. Which of the following explanations would account for her symptoms? The symptoms may be the result of anemia caused by the chemotherapy. The patient may be immunosuppressed, may be depressed or dehydrated. Where's my chemo nurse that was in here? Where the answer at? Ryan, thank you for the follow. Nicole says A. Okay. Shout out to y'all. Appreciate everybody all up in here. Appreciate all 700 y'all here rocking with me. I want to know who you are, where you're from, where you're at in your nursing journey. We're doing NCLEX questions. All right. I got these questions off nurselabs.com. I keep getting that question. That's where I got them from. I do these lives every Monday, Wednesday, Friday at 5:30 Central Standard Time in Texas because that's the only time that matters. Just saying, fatigue, a key word. All right. I'm going to give y'all 10 seconds. All right. Appreciate the follows. Bridget, retired LPN. Shout out to you. West Virginia. First semester accelerated nursing program. It's hard, but it can get through it. Hey, nursing school is hard. It's meant to be hard. It ain't meant to be easy. If it was, every fool would want to fucking do it. Taking farm and funds too. Shout out to you. All right, here we go, y'all. Here we go. Here's our answer. Answer coming in 3, 2. Los Angeles. Shout out to you, Travis. All right, the answer is A. The symptoms may be the result of anemia caused by chemotherapy. 3 months after surgery and chemotherapy, the patient is likely to be feeling the after effects, which often include anemia because of bone marrow suppression. Outskirts of Orlando. Oh, so you live like in Kissimmee, aka in Disney, like Disney World. Let's go, Shanice. I see you. Texas 956. Oh, you from the Valley? Lord of mercy. Hey, I know all about the Valley. Been there a lot. You know, I've been there a lot. You know what I'm saying? So, shout out to y'all. Kansas just started my nursing school 6 weeks ago. Shout out to you. Shout out to you. What was the most helpful thing you learned in nursing school that you used on your job? Pathophysiology and pharm, honestly. All right, here we go. Hey, reduction in risk management, right? How can we help people that have these issues? We want to reduce the amount of risks and the amount of injury that we can, prevent from happening to a patient, okay? Here we go. Question number 19. I have my first interview tomorrow. Lily, you're going to be Gucci out there. Don't worry about that. You good? Patho was crazy fun. Patho was one of my favorite classes, I promise you. A clinic patient has a hemoglobin concentration of 10.8 and reports sticking to a strict vegetarian diet. Which of the following nutritional advice is appropriate? The diet is providing adequate sources of iron and requires no changes. The patient should add meat to her diet. A vegetarian diet is not advised. The patient should use iron cookware to prepare foods such as dark green leafy vegetables and legumes. I actually just said that right for the first time, like the other day, by the way, which is high in iron. Or a cup of coffee or tea should be added to every meal. We got C's. Y'all are screaming at me, C's. Okay, I got you. I just saw VA. Shout out to VA. Graduate 80 in November 3rd. Hey, that's right around the corner. Right around the corner. You got this. All right. What are we doing? What do we got? East Texas, level 4, graduating in 52 days. ED, go ahead. Go ahead. New Orleans in the house. Shout out to y'all. I'm going to give y'all 15 seconds. Hey, we're doing NCLEX questions. Army nurse, ill. No, I'm just playing. Shout out to my Army nurse. Shout out to all my military nurses. You know what I'm saying? The Navy doesn't want me to be great. So I won't be a military nurse. I'm just going to retire as enlisted. How hard is farm? Farm is probably one of the hardest. I'm just playing, Kingston. I'm just playing. Farm was probably honestly one of the hardest classes I ever took. And farm is still hard because there's so many medications that are out there that you have to know. And the side effects, right? Farm is easy, debatable. All right, here we go. Answer in 3, 2. And remember, I said farm was hard for me. I didn't say it was hard for me, but pharmacology is a monster. It is a monster of a section. It is C. The patient should use iron cookware to prepare foods such as dark green leafy vegetables, legumes, and because they're higher in iron, right? You want the normal hemoglobin. So here's the thing. Hemoglobin and hematocrit, they're usually going to change, right? Some policies say different in hospitals. NCLEX will say something different. Now, if I say something about my hemoglobin being 6, I know that that's a problem, right? If I see my hematocrit in the 60s, I know that that's a problem. Right? So some of these numbers aren't going to match up. But the good thing on NCLEX is that they give you the ranges, right? But what you have to know is when these ranges are out of range, either above or below, what the patient is going to display, as well as what you are going to do to effectively and safely take care of this patient. Like, what is your next step? That's the best thing and biggest thing about clinical judgment and critical thinking. Okay. Shout out to everybody that's following. Appreciate you. Hey, basic care and comfort, right? 9 to 12% of the NCLEX. Here we go. Question 20. The COVID ICU whooped me. Hey, I worked in a COVID ICU for 7 or 8 months. I worked in a burn ICU for about 6 months. So look, I understand. Trust me, I got you. Question 20. A hospitalized patient is receiving packed red blood cells for treatment of severe anemia. Which of the following is the most appropriate statement? Keyword in there, the most. Or keep those, I guess that's 2 words, but most, right? A, transfusion reaction is most likely immediately after the infusion is complete. Packed red blood cells are best infused slowly through a 20-gauge IV catheter, should be flushed with 5% dextrose. A nurse should remain in the room during the first 15 minutes of infusion. Everybody's telling me D. Stephanie, thank you for the follow. Jess says D. We got D. This is where you need to know the process of administering blood products. I don't care what no state says. On a national level, LPNs, you cannot do it. You can't do anything blood reaction or blood. You can't do anything blood transfusion. Okay. It is all about safety, right? I don't care what your state regulations say, but according to NCLEX, which is a national standard, as an LPN, you cannot do blood anything. However, you need to know. You need to know all the content that an RN needs to know. But biggest difference is that you need to know what you can and can't do and what you can and cannot accept as an LPN. It says, can't you pre-med them? You can. However, is that on here? No, don't give more. Don't give more than you should, or you're going to get the question wrong. Thank you for the flower. Appreciate you. Here we go. Here's our answer. Here is our answer, y'all. Here we go in 3, 2. And the answer is D. The nurse should remain in the room during the first 15 minutes of the infusion. Transfusion reaction is most likely during the first 15 minutes of infusion, and the nurse should be present during this period. Physiological adaptation, 3rd largest section on NCLEX. Hey, don't throw in any type of anything where it's telling you need to pre-medicate anybody. That's not what they're asking you. You take what they say at face value, and then you use your clinical judgment and your critical thinking to navigate the trend. NCLEX's perfect world. Exactly. That's exactly what it is. You have all the help. You have everything. You have the order, all that good jazz. Okay. All right. Looks like we're good. I was fortunate to work at a hospital that allowed menstrual hang blood chemo. Hey, I'm just saying, because like I said, on a national level, you can't do it. Hey, quick commercial break. Hey, participate. I love all the participation. I want y'all to keep doing it. Like, share, follow. Don't be greedy, okay? Give me all them likes. Don't troll my chat. Y'all are awesome. Y'all aren't trolling. Some people I had to block already, and that's cool. Usually I scream out 600, and I didn't do it. I got these questions off of nurselabs.com. That's where I got them, okay? You guys can go over there and look at them yourself. 7-day NCLEX course. That's a course I created. It's in its pre-launch phase. $48 for a lifetime. It's not. Once you get it, you get all the updates. And if you need one-on-one coaching with NCLEX, you guys go over there. Those links are in my link tree in my bio. All right, here we go. Question number 24. A patient who has received chemotherapy for cancer treatment is given an injection, right? Is it a epotin? Sorry, like I said, I will mess words up, and I'm okay with that. Which of the following should reflect the findings in a CBC drawn several days later? Is it an increased neutrophil count, increased hematocrit, increased platelets, or increased serum iron? What do we got? We got some C's, we got some A's, we got some B's. Tori says B. BNP says C. Okay, Sherry says C. Hey, if you're new here, I want to know who you are, where you're from, where you're at your nursing journey. We're doing NCLEX questions. All right, I want to make sure you guys smash that like button. All right, make sure you guys like, make sure you guys share and follow. Sharing for all 3 of those components help push this out to everybody who needs it. Shout out to Pittsburgh. I ain't never been there, but shout out to y'all. 10 seconds. 10 seconds. We got some A's, we got some B's. Okay. B, iron is an NCBC. Look at you. You so smart. Hey, shout out to all y'all. Y'all in here rocking it. You graduated in December. Fort Lauderdale. I've been there once or twice. Cincinnati, Ohio. Shout out to you. Hey, I'm just playing, y'all. I'm just playing. Candace says C. Okay. All right, here we go. I'm going to PA school. Shout out to you. I got 2 of my buddies who graduated from PA school. And that what is it? Is it that pants? That pants is kicking their ass. Like, for real. It's really kicking their ass. All right, here we go. Here's our answer in 3, 2. And the answer is B, an increased hematocrit. All right. What is it? Epotin, which is a form of the erythropoietin, which stimulates the production of red blood cells, causing an increase in hematocrit, right? And it's given to patients who are anemic, right? Often as a result of chemotherapy treatment. So shout out to everybody that got that answer correct. Reduction of risk potential, right? I'm a travel nurse, been a nurse for 4 years. Shout out to you. Is it Grove? Nymphs Grove, right? How you like that travel nursing? You like that travel money? Hey, let them know that there's still travel money to be made out here. Let them know, because the myths and all this other shit that people are talking about, there's no money in travel nursing. Let them know. Hey, Miranda, I didn't know we were on your time. Don't rush me. All right. Don't rush me. All right. I got you. I'm moving right along. All right. Here we go. Question number 22. A patient is admitted to the hospital with suspected, polycythemia vera. Which of the following symptoms is consistent with this diagnosis? Select all that apply. Hey, so select all that apply. Put them all in there, right? So is it weight loss, increased clotting time, hypertension, headaches, or polyphagia? Headaches, baby. All right. What we got? You got. I got it right. I haven't worked bedside in years. I still got it. You still got it, lady. You still got it. Dre says B and C, B, C, D. I currently work in. Hey, shout out to all my oncology nurses in here. Y'all are good. So here's one of the things. It's just like, hey, if you don't, this is where I tell people, it's just like, I don't know what that is. This is where you need to go, and you need to brush up on that content. All right. Dang, I could have answered this. I knew that probably. I got you. I'm a pediatric nurse here. Shout out to you. Shout out to you. All right, I'm gonna give y'all 10 more seconds. And that's, who's that? Is that Jay Watts? You have PV. You can't answer. That's cheating then. Oh, Miranda. Okay, I got you. All right. Hey, we had a couple of cancer questions up in here. Shout out to all my cancer nurses out there. Shout out to y'all. All right, here we go, y'all. Here we go. Here's our answer. I remember this in order, name, but nothing about it. It happens. Hey, as a nurse, you're not gonna remember everything, y'all, and that's okay. That is okay. All right. Here we go. Here's our answer in 3, 2. It is B, C, and D. Polycythemia vera is a condition in which the bone marrow produces too many red blood cells. Right. This causes an increase in hematocrit and viscosity of the blood. Patients can experience headache, dizziness, and visual disturbances. Cardiovascular effects include increased blood pressure and delayed clotting time. I got 2 right. Shout out to you. Is it Gabrielle? It's Gabrielle. It's Gabrielle. I'm gonna go with that. If I'm wrong, then whatever, So if I'm wrong, like whatever. It's okay. All right, here we go. Hey, shout out to y'all for getting. Hey, select all that apply. Hey, by the way, on NCLEX now, by the way, it's partial credit. So like if this is like if it's based off of like 5 points and if you got some of them wrong, then you can, let's just say it's, it was B, C, and D, but you pick B, C, D, and A. So instead of 3 points, you would get 2. So it kind of cancels itself out. Yeah, partial credit. You know what the deal is. Here we go. Question number 23. It says, I want to know the rationale for D. Hey, I'm just letting you know. These aren't my questions. All right? When you guys start studying with other programs, the rationales are a little bit more in depth, okay? So here we go. Who calls Kyle? What? Anyways, question 23. The nurse is caring for a patient with a platelet count of 20,000. Which of the following is an important intervention? Observe for evidence of spontaneous bleeding. Limit visitors to family only. Give aspirin in case of headache. Impose immune precautions. Hey, yo, okay. All right. Hey, if you guys are new here, make sure you guys smash that like button. Make sure you guys share. Make sure you guys follow. We're doing NCLEX questions. I got these questions off nurselabs.com. All right. I want to know who you are, where you're from, where you're at in your nursing journey. I don't care if you're a brand new nurse. I don't care if you're in nursing school. I don't care if you're doing prereqs. I don't care if you said today, I want to be a nurse. Hey, because it's a journey. I want to know. Easy money. Next. Oh, okay. I didn't realize that we were still on your time, Miranda, but whatever. Here we go. 5 seconds. Here we go. And 3, 2, and the answer, of course, is A. Observe for evidence of spontaneous bleeding. Who gave me that big old heart? Appreciate y'all. Platelet counts under 30,000 may cause spontaneous petechiae and bruising, particularly in the extremities. When the count falls below 15,000, spontaneous bleeding in the brain and internal organs may occur. Headaches may be a sign and should be watched for. Nursing assistant in Guam. Shout out to you, Brittany, being in Guam. I know some people that live in Guam. I have some friends that were stationed in Guam too. So shout out to y'all. Hey, reduction of risk management. All right. Remember that section. It says Delaware Farm Tech now in and out of patient coder. Blah, blah, blah. Okay, gotcha. All right, here we go. Question 24. Y'all are rocking it. Right now. Here we go. Question 24. A nurse in the emergency department assesses a patient who has been taking long-term corticosteroids to treat renal disease. Which of the following is a typical side effect of corticosteroid treatment? Select all that apply. I was about to say glucocorticoid because I was reading that yesterday. Anyways, is it hypertension? Is it cushingoid features? Is it hyponatremia, low serum albumin, or is it mood swings? Remember, select all that apply. Select all that apply questions are partial credit. They are partial credit on NCLEX now. I wish I would have had that when I took it. Hey, just a little thing. Hey, I failed my NCLEX 3 times, y'all. When I failed it, I got 75 questions on the first one, 265 on the second one, and 106 on the third one. And then when I passed the fourth time, at 60 questions, it was right when COVID happened. So I'm just letting y'all know, y'all got this. That's for anybody out here that thinks that they can't get out here. You about to be, you remember it like this. You're unsuccessfully successful. That's for everybody. I don't care what nobody tell y'all. Everybody in here has failed a test. All right. And if you don't understand what it's like to be a failure or to fail these things or be unsuccessful, hey, I don't know if I really want advice from you, because if you can't learn from your mistakes, then how are you gonna be able to teach anybody else? I'm just letting y'all know. Yeah, this is it is a good question. How much did it cost to take the NCLEX? It depends on the state, but in my state, it was $300, $100 for the application and $200 for Pearson View. All right, here we go. Here we go, y'all. You're my inspiration. Hey, stay here. That's what I'm about. Failed NCLEX 3 times. Hard to get motivation back. Thank you for doing this. Look, I'll give you all the motivation in the world. Hey, I do an AMA after this, by the way, after I do questions. Here we go. Here's our answer in 3, 2. Andy, what'd you say oh my for? And the answer is A, B, C, and D. Side effects of corticosteroids include weight gain, fluid retention with hypertension, cushingoid features, low serum albumin, suppressed inflammatory response, and mood swings. Patients are encouraged to eat a diet high in protein, vitamins, and minerals, and low in sodium. Missed one, my bad. Don't tell me my bad. Remember, it's still partial credit. Answer what you can answer. But here's one thing I will tell you. If you don't know an answer, don't pick it. If you don't know, don't pick it. UWorld is also a good site to use for practice question or for practice for NCLEX. Yeah, but you have to pay for UWorld too, so helps so much. UWorld is great if you have a really good understanding of content, because that's all they give you is questions. Because isn't that $1,200 on taking it? That hurt me. Look, I spent over like a total of almost $3,000 on everything for me to become a nurse when it comes to those practice stuff. So I understand. Here we go. Commercial break. We're doing NCLEX questions, y'all. Make sure you guys participate. Give me all the likes. Give me all the love. Smash that like button. Make sure you guys share and make sure you guys follow. Those 3 things are the most important, okay? Don't troll my chat or I'm going to ban that ass. I got these questions from nurselabs.com. Check out the 7-day NCLEX course. And if you need one-on-one coaching for NCLEX, you can check that out. All those links are in my bio, okay? Check that out. In the bio, it takes you to a link tree, okay? Here we go. Question number 25. Man, we got a lot of oncology up in here. So shout out to, ironically, all the oncology nurses coming up in here. A nurse is caring for a patient in the oncology unit. Which of the following is the most, keyword, the most important nursing action when caring for a neutropenic patient? Y'all hear my son back there? He acting a fool. Change the disposable mask immediately after use. Change gloves immediately after use. Minimize patient contact or minimize conversations with the patient. All right, we got C's. I'm going to give y'all 20 seconds. Thank you for contributing. Hey, y'all, appreciate y'all. Y'all are contributing. Y'all so nice. Hey, if you guys are new here, welcome. We're doing NCLEX questions, right? Got to think, what is a neutropenic patient, right? These are those terms. There are terms that you got to realize, right? All the above. You got to give me one. You got to give me one, okay? You can't give me all of them. This is not select all that apply question. Gabrielle says C or B. Gabrielle, you got to give me one. Is it Ariona? Is it Ariona? Ariona. Is that how you say your name? Chelsea says C. All right. 5 seconds, y'all. Here we go. Here is our answer. Our answer in 3, 2. And the answer is B. Change gloves immediately after use. The neutropenic patient is at risk for infection. Why? Why are they at risk for infection? Because they ain't got no armies to help fight off any diseases, right? Because that's what happens. Changing gloves immediately after use protects patient from contamination with organisms picked up on hospital surfaces. I don't know if y'all know this, but the hospital floor is nasty as hell. Or any surface by that, you got to make sure you guys got to keep it clean. This contamination can have serious consequences for an immunocompromised patient. No, wrong, maybe. All right, well, I thought it was B. Changed my answer. I just passed NCLEX. Remember, pick the safest. Yeah, safest. Hey, so it's all, hey, NCLEX is about nurse safety. Nurse safety, okay? That's the biggest thing. All right, physiological adaptation, third largest section, bad question as a nurse. I don't disagree with you. I don't disagree with you. Where you got to remember is that the NCLEX, when they write, for NCLEX style questions or NCLEX questions at all, it's based off of a standard, right? It's not based off of policy that happens in hospitals. And some of these questions we're not going to agree with. Some of them are just going to like not make sense and they're going to be wrong. No, I don't do anything with medical or the med school. I don't do med school, so I can't help you with USMLE. So, all right. Hey, physiological adaptation, third largest section on NCLEX. All right, here we go. Question number 26. A patient is undergoing the induction stage of treatment for leukemia. The nurse teaches family members about infectious precautions. Which of the following statements by the family members indicates that the family needs more education, right? So what did they say that was wrong that you need to reiterate and clarify? All right. We will bring books and magazines for entertainment. We will bring a personal care item from home. We will bring fresh flowers to brighten the room, or we will bring a family picture and get well cards. Some people are going to come in here and say that this answer is easy, yada, yada, yada. Look, I don't care. I don't care what you think about it being easy. First of all, it ain't about you. It's about understanding that others are not in the position that you are in. And so that way they can understand this as well. All right. It's all about getting in a rhythm. All right. So we got C's. All right. I'll give y'all 10 seconds. Lots of germs on surface. Okay. All right. Shout out to all 500 y'all. This is why they say when you don't know, just pick C. Ma'am, Camille, don't come in here doing that. Don't come in here doing that. Not a nurse working in a lab. And I know that flowers are germy. Yep. There you go. Here's our answer, y'all. Here is our answer. Hey, by the way, don't come in here don't come in here rushing me either. You rush me, I'm going to give you a 600. I promise you. Here we go. In 3, 2, and the answer, of course, is C. During induction chemotherapy, the leukemia patient is severely immunocompromised and at risk for severe infections. Fresh flowers, fruit, and plants can carry microbes and should be avoided. There's another thing. Hey, what do we, somebody in the chat, tell me about water. What is it about water? What is it about water when we give water to a, immunocompromised patient? I'm going to go on to the next question, but I want to see y'all. Can't let it sit, right? Can't sit long, right? Can cause, amnios and microbes, right? Because usually oncology patients, at least on our floor, like they actually have water that's in a specific place. Like, and then they have to give it to them and they only give it to them in certain amounts, right? They give it to them bottled, right? Yeah, they give it to them bottled and it can't sit out. Like once it's open, hey, you need to do it. You need to be able to drink this shit because if not, you can't let it sit out long because we don't need no stickies and no ickies inside your body. You know what I'm saying? So here we go. He is cancer free. Thank you. Shout out. Who's cancer free? Somebody can. Hey, shout out to whoever is cancer free. All right. Question 27. A nurse is caring for a patient with acute lymphoblastic leukemia. Which of the following is the most likely age range of this patient? Is it 3 to 10, 25 to 35, 45 to 55, or over 60? Remember, it says most likely. Doesn't mean that some of these other ones, other people won't get them, but the most likely, the average range of the age for a patient to get this answer. What says all most kids are most common in children. Got you. We got A's. I'm gonna give y'all 15 seconds. Hey, if you guys are new here, we're doing NCLEX questions. All right, make sure you guys like, share, follow. That's the trifecta of get this information out there to folks. Okay, make sure you guys do that. Labor and delivery nurse. Future labor and delivery nurse. Shout out to you. Thank you for the follow. All right, y'all. Here we go. Here's our answer. I'm getting a bunch of A's screamed at me. So here's our answer, y'all. Here's our answer in 3, 2. And the answer, of course, is A. The peak incidence of ALL is at 4 years. So the range of 3 to 10 years. Okay. Part of health promotions. No cheating. What you mean? Yeah. So part of health promotions and maintenance. Hey, is there anybody in here that's taking their NCLEX tomorrow? If you're taking your NCLEX tomorrow, I'm going for you to go away. Go away. Because if you've been studying properly, you don't need this. All right. You don't need it at all. All right. Because if you don't know now, you don't know it at all. So if you have studied for your NCLEX and you take your NCLEX tomorrow, go away. Go away, and I will see you on Wednesday or on Friday where you come and let us know the results. All right. That's just me that's just me giving y'all tough love. That's what I'm about. I don't coddle you. We cramming? No, we ain't cramming around here. We ain't cramming around here. Go away if you take your NCLEX tomorrow. 3 months till NCLEX for me. All right, Gabrielle. Well, the day before your NCLEX, go away. Don't be over here. Here we go. Question 28. A patient is admitted to the oncology unit for diagnosis of suspected Hodgkin's disease. Which of the following symptoms is typical of Hodgkin's disease? Is it painful cervical lymph nodes? Is it night sweats and fatigue, nausea and vomiting, or weight gain? What are we thinking? Shout out to all y'all. Shout out to all 600 plus of y'all. I want to know who you are, where you're from, where you're at in your nursing journey. I don't care if you just told me today that, hey, Kevin, I want to be a nurse. I'm like, all right, bet, go make it happen. I don't care if you're in prereqs. I don't care if you're in nursing school. I don't care if you've been a nurse for 40 years. Let us know down in the comments. You failed twice? Cool. So when are you taking it a third time? When are you taking it a third time? Houston, nurse for 5 years. Shout out to H-Town. Jamaica in the house. Shout out to y'all. 10 seconds. Fundamentals. Okay. End of the month. Okay. Passed in September. Shout out to you. That was last month. Hey, that wasn't even that long ago. Indiana. I know some folks from there. Charlotte. Okay. Graduated in December. ICU. I worked in the ICU for a little bit, or the neuro ICU for a little bit, between a medical and a neuro ICU. So, all right, here we go, y'all. Here we go. Here's our answer. Here's our answer in 3, 2. And our answer is B, night sweats and fatigue. Symptoms of Hodgkin's disease include night sweats, fatigue, weakness, and tachycardia. Physiological adaptation. The third largest section. A nurse for 38-year nurse, user 99. Shout out to you, sir or ma'am, or whoever you are. It's time to go. It's time to, retire and go enjoy some beaches somewhere, So I would go do that. You know what I'm saying? You got it right. All right, here. Shout out to you, Thor. Hey, for all my nurses that are out there, let people know that you're not going to know everything and you're not going to get all these answers right. And you're not going to see all these when you become a nurse and start working on the floor. Like, let these folks know. Let them know down in the comments. All right. Because some people be trying to come after me. And I don't care. You know what I'm saying? I don't care that they come after me, but apparently I might be lying because I don't know what the fuck I'm talking about, but y'all let them know. Y'all let them know. Here we go. Question 29. The Hodgkin's disease patient described in the question above, which was the previous one, undergoes a lymph node biopsy for definitive diagnosis. If the diagnosis of Hodgkin's disease were correct, which of the following cells would the pathologist expect to find? He's right, you guys. The test is what? The test and the real world are very different. Very much so. Here we go. Is it the lymphoblastic cells? Is it the Reed-Sternberg cells? Is it the Gotcher cells or the Reeder cells? Oh, we got some A's. We got some B's. Got Reed. Okay. Reed. I haven't heard. What is it? I haven't heard what? I haven't heard the other three, so I'm going to go with A. Hey, so I'm saying, so a lot of times if you don't know these questions, here's what I like to say. It's just like you can't apply what you don't know, but you can apply what you do know. So if something looks familiar to you, pick it. NCLEX is Perfect World Nursing. Let them know. Because for some reason, NCLEX insists we know this. Yeah. And I'm telling you right now, if you're on NCLEX and they give you a hard question, that's the goal. You want to get to the hard questions, right? You don't want easy questions. Trust and believe me when I tell you that. You do not want easy questions. All right. Here we go. Here's our answer. Here's our answer for somebody to get in my chat and start telling me to hurry up and then I get mad. Here we go. And 3, 2. The answer is B, the Reed-Sternberg cells. A definitive diagnosis of Hodgkin's disease is made if Reed-Sternberg cells are found in pathologic examination of the existed lymph nodes. Okay. All right. Hey, that's a tough question because if you don't know, you don't know. I'm just being completely honest. What if you're a cancer research nurse? Miranda, are you a cancer research nurse? Then you know the answer. But you got to remember is that it's all based off of, perfect world. I knew it, Miranda. Miranda, smarty pants up in here. I see you. All right, here with physiological adaptation, y'all. Remember, third largest section on NCLEX, okay? Non-Hodgkin's doesn't have it. There, look at that, because it's non-Hodgkin's. I'm so scared to do transitions. Last part of my nursing school journey. Elizabeth, don't be scared of it. All right? Who said resend the question? So, hey, just like NCLEX, we ain't going back. Once you pick your question on NCLEX, you can't go back. All right, so we going forward. Here we go. Question number 30. A patient is about to undergo bone marrow aspiration and biopsy and expresses fear and anxiety about the procedure. Which of the following is the most, keyword, the most effective nursing response? Warn the patient to stay very still because the smallest movement will increase their pain. Encourage the family to stay in the room for the procedure. Stay with the patient and focus on slow, deep breathing for relaxation, or delay the procedure to allow the patient to deal with her feelings. Right? This is a therapeutic communication response, right? Good therapeutic communication skills are very, very important. I promise you. They're very important. And I'm telling you, they're a part of psych questions as well. They're a part of psych questions as well. Who's that? KY King or KY Queen? I see you out there. Ashley says C. Aaron, thank you for the follow. Like I said, it's like the good therapeutic communication skills, right? It's not only in psych, it's also in, med surg and other types of things that we have going on. All right. I'm gonna give y'all 10 seconds. Hey, just after this, I'm gonna do an Ask Me Anything, regards to nursing, right? So we're gonna do that next after we do these questions. All right, here's our answer. Here's our answer in 3, 2. And the answer is C. Stay with the patient and focus on slow, deep breathing for relaxation. Slow, deep breathing is the most effective method of reducing anxiety and stress. Okay. It reduces the level of carbon dioxide in the brain to increase calm and relaxation. Part of physiological adaptation. Are there any ED nurses in here? There was a few, I think, that were in here. Part of physiological adaptation. Remember, when you guys are studying, even for my nurses out here, when you're trying to go for those certification exams, when you guys are studying, you guys already know the deal. Read the rationale to see why it's correct, right? But then also read your options to see why these are incorrect, because you'll never know if there's a question 4 or 5 questions down the line that this one can almost mirror. Okay. So don't forget that. And that, ladies and gentlemen, wraps up our questions for today. We usually do about an hour of questions, and then we do Ask Me Anything. I appreciate everybody hanging out. Thank you for all the love. I think I got more gifts today than I did on anything, right? Miranda, look, you already know what the deal is. All right, I didn't have to ban nobody today. Like I said, I got these questions off nurselabs.com, right? Check out the 7-day NCLEX course. Make sure you guys check out thebootnurse.com. And that's how we do. So now what I'm about to do, I'm about to turn this damn camera around so you guys can see my face, because apparently, that's what everybody wants to see, right? And so what's up, y'all? How y'all doing? Hey, before anybody starts to say I look like Jason Derulo, I already know, okay? And I'll start singing songs if you want me to, even though I only know one, and he dated Jordan Sparks. But whatever. Anyways, what's up? What's up, everybody? My name's Kevin. Of course, I go by the Boot Nurse. Make sure you guys go over there and check out the link tree. Go follow me on YouTube, because every TikTok live that I do, it goes up there. Okay. Elizabeth says, when do you usually go live? Monday, Wednesday, Friday. 5:30 Central Standard Time. Jason? Oh, look at you. Who said, excellent. Allison, thank you. I appreciate it. How long have you been a nurse for? I've been a nurse for 3.5 years. I always say, once you think you know everything, we learn. Yeah, true. You're the GOAT. I appreciate it, Alex. I hope you're here in 2 years. I hope I'm here too. I enjoy doing this, actually. Thank you so much. You're welcome. I could not believe that still got to remember some of our lectures in med-surg in the 4th year. Yep. What does that say? It says, do you think it's better to start off in med-surg rather than going to a specialty? No, I don't. You can go wherever you want, right? Remember, med-surg is a specialty, guys, ladies and gentlemen. Med-surg is a specialty, right? You can go wherever you want. However, med-surg, you will definitely get you'll definitely get your time management, so on and so forth, just like everywhere else, right? So med-surg, you can go there for sure. Thank you for this. You're welcome, Izzy. I started nursing school in January. I'm nervous. Don't be nervous, because it's coming. It's coming. Bailey, how do we know what the starting pay should be if moving to a new state? Honestly, I'm not even gonna lie to you. That's just all Google research. That's all Google research. Because every state is going to be different. Like in Texas, when I started working as a nurse, they were paying $25 an hour. And then now they start nurses out at like $30 an hour, right? Taking NCLEX in 2 weeks. What do you think I should know? You need to be familiar with everything. You need to know pharmacology. You have to be familiar with that. Management of care. You need to know the 8 sections of the NCLEX SPI. But pharmacology and who to see first and all that, you need to know those things for sure. It says, I got accepted into nursing school and I really want to be a sports nurse. Where should I start? Not even gonna lie to you. This isn't even being an asshole. You got to do the research on where you need to go to be a sports nurse. And what type of sports nurse? Are you talking about like go be in the NFL because they got nurses that work in the NFL that are part of teams like that. I'm interested in ICU and in labor and delivery, and I graduated in May. Is it hard to switch once you are actually working? No. So labor and deliveries now, they want you to have at least a year to 2 years of experience before they move you. But then they have labor and delivery residency programs. Also, it's not hard. It's not hard. It's not hard for you to switch. Some places don't want to take you, but that's what you do your research for to see who's available. Is the ER department difficult for new grads? No, it's not. Any department could be difficult, right? It's all about you going in there, being prepared, being a sponge, applying everything that you're learning, asking tons of questions. Now, if you're getting people who are fucking assholes to you and telling you to just figure it out, that's a problem. I can't seem to pass the NCLEX. Why? You got to give me more context on why you're telling me you can't pass. Bailey says, awesome, thank you. You're welcome. California 40 plus doesn't accept lower. So think about it. In California, the cost of living is fucking through the roof. You know what I'm saying? In Texas, the cost of living is drastically lower. So, of course, it's going to be 40, I want to be a psych nurse for veterans. Do it. Go do it, Izzy. Go do it. Any advice for someone starting CNA school soon? Be a sponge. Absorb everything, right? Nurse or ultrasound. Depends on what you want. I'm not the one doing it. You are. Did you actually know that you could be a nurse that works in radiology and be a radiology certified nurse? Did you know that? I'm just saying. Can you become a peds nurse right after graduating, and do you need experience? You can go into peds right out of school. You just got to find the residency programs for them. Taking NCLEX soon. Glad I found you. I'm glad you found me too. Okay, I'll research, but I was thinking more of soccer. So here's the thing. It's just like, if you want to do something sports related, don't bottleneck yourself. Like, don't try to say, oh, I only want to do soccer. Open your eyes up to other sports, right? Because what happens in sports? They have high intensity injuries like ankle sprains, like, ACLs, tears, all that stuff, right? Because all sports relatively all have the same type of injuries. Just some are more common than others, right? So don't keep yourself in a bubble when it comes to that. Taking 1 month nervous. The biggest thing to study is pharmacology. I wouldn't say the biggest thing to study is pharmacology, but pharmacology is the second largest section on NCLEX. So I would definitely tell you that you have to study pharmacology. Okay, depends on where you live. Honest opinion of a residency. I think residencies are good depending on the hospital. If the residency programs are good depending on the hospital that has them. If it was my choice, I would do it all over again. Go to a level 1, listen to me, a level 1 trauma facilities residency program. California, Oklahoma, 32. Yep. Colorado, going to school in Utah halfway through the first semester. Shout out to you. Izzy said, I feel hands-on experience is much better than these tests. But yeah, you have to do it. You have to do it. You ever thought of switching careers? Technically, nursing is my second career. I've been in the Navy for 16 years. I'm enlisted. If anybody saw me, doing my live this weekend, I was in my uniform and I was like, you know what? Some people were like, hey, do it in your uniform. And I was like, well, I had just got home and I was like, man, let me shed some knowledge on y'all. So, technically nursing is my second career. And yeah, so there's that. ER newbies have often been told that they are at an increased risk of losing their license. It doesn't matter what floor you work on. As a newbie, period, you are at risk for losing your license. So you're taking... it says your take on starting med-surg, IC, or ER. Wherever you want to go. Is it Linnea? Linnea, wherever you want to go. Wherever your passion is at for where you want to, focus your nursing knowledge. Cath lab nurse here. We do interventional radiology nursing, radiology too. Shout out to you. Do you recommend getting your BSN or just your ADN enough to be and complete? So here's the honesty. Once you get your ADN, you get the same license that a BSN does, right? Now, if you want increased responsibility and all that other good jazz, you have to climb that ladder. You have to climb that ladder, depending on what you want to do. But one of the nurses that I worked with, she's been a nurse for 10 years, has her ADN nurse, and she's one of the managers of the floors, and she's probably one of the nicest and best nurses I've ever met. So it all just depends on you. Okay. Oh, okay. Thank you. I didn't even think of that. I've been so focused on soccer. No, don't focus on soccer, because if you only focus on soccer, like I said, you put yourself in a bubble. You could find opportunities in fucking lacrosse or in water polo or football. Hell, there's a girl I follow on TikTok. She's an NFL nurse. That's, what I'm saying? So don't put yourself in a bubble. You may need hospital experience before moving to sports. since you're most likely independent there. Yes. Most likely. I don't know what the criteria is for sports nursing for sure. I'm a senior. I start college in the fall of 2024 for BSN. Is there anything I should use to prepare? I would definitely start looking up pharmacology. Definitely pay attention to pathophysiology as well as, A&P 1 and 2, right? What are the top three biggest sections on what? What are you talking about? Residency depends on your preceptor. So residency it doesn't only depend on your preceptor, although that is a huge part of it. Thor, 100%. Because I was in a residency program that was, in my opinion, it was fucking terrible when I started doing the residency program in the ICU. And then I had 9 preceptors, 9. So it was just not fucking good at all. So like I said, but it should have been, I should have went to a level 1. That's what I should have did. I should have did that, but shoulda, woulda, coulda, here we are. Is that thank you for your service. I appreciate your support. Are you going to do 20? I don't know. I'm in the Army Reserve. Shout out to you. Thank you for your service. Thank you for your support. I appreciate you. Do you have to challenge the board for NCLEX like Air Force, or do you actually attend nursing school? So the Air Force, the Air Force, the Navy, and the Army, or the Army is the only one that has an LVN program, right? There's only certain states that you can challenge a nursing board. The only nursing board that you can challenge is LVN, and only certain states do that. I need for all of my military folks to hear me on that. Okay, you cannot in no state or in Canada challenge the NCLEX RN exam. You cannot. You have to go to school. I don't care what anybody's telling you; they're lying to you. Linnea says, thanks. I've had so many people tell me to start in med-surg to get basic skills. You don't have to do that. You don't have to do that. However, med-surg is there. So if you want to go there, I tell people to go to med-surg if they don't know where to go. But remember, med-surg is a specialty. I don't shit on people on med-surg. I love med-surg, especially the LVNs that work in there. I graduated nursing school, headed to the OR. Can't wait. Shout out to you. Is it Rachel? I'm just going to call you Rachel. 3 biggest sections on NCLEX: management of care, pharmacology, physiological adaptation. Those 3 sections alone make up 44 to 49% of the entire exam. Do you have any tips for HESI exit exam? To be honest, is wherever the sections are on the HESI exam, I think it's like those Elsevier, Sonder books or whatever, I would definitely study that for sure. But a lot of it is going to be management of care and that transitions and farm. Okay. I'm thinking about going to CNA school. Any advice? Do it. I started CNA 15 years ago, did psych side of things as a behavioral health tech, now 34, starting out of college. I didn't get my nursing license until I was like 32 or 33. I graduated nursing school at like 30 or 31. So your age has nothing to do with nothing. Challenging that seems dangerous. Now, here's the thing is, in order for you to challenge it, there is a criteria that you have to follow, meaning you have to have worked in an inpatient unit. You have to get signed off by nurses. It has to go up to the board of nurses. There is criteria. You can't just be like, hey, let me do the LVN. It doesn't necessarily work like that, So, what do you think about hospice? What experience do you need? Usually for hospice, you can go straight into it. But most people that do, they have experience like a year or 2 working at least med-surg or some type of critical care where, you're dealing with death and dying patients. So it all that would be my thought process. But you can go straight there. They hire. So I heard once you pass med-surg, you can challenge the LPN. Oh, you're talking about med-surg and when you're in school. So yeah, if you're in a BSN program or if you're in an ADN program, once you get past a certain class, you can then challenge it. I got told that and I was just like, no, I'm not even going to focus on that because I didn't need to go out there and be like, I needed to work. You know what I'm saying? So that HESI isn't as hard as they make it sound. Know your nursing implications. Like I said, everybody is different. Everybody is different and it depends on how they study. I already told you what the biggest sections were. And I'm trying to catch up on you guys' questions. Yeah, I'll be 40 when I graduate. She is just a number. That's what I'm trying to tell y'all. Don't be worrying about it. I had people in their mid-50s that were going to nursing school. And then I had those people in the mid-50s, those nursing instructors were talking to them like they were losing their fucking mind. And those people in the 50s were like, I don't know who you're talking to like that. You better chill the fuck out. Bailey says, oh, okay, that makes so much sense. Yeah, you're welcome. No problem. Bubble says, what to consider before considering into becoming a nurse. I don't even know how to even answer that. Med-surg for hospice is my opinion. Yeah, I would agree. What type of nurse are you, if you don't mind me asking? Right now, I'm a surgical, not a surgical. I'm a scrub / circulating nurse, and I work in the operating room. But right now, I had surgery on my knee because I fell in the operating room. Doing patient care and all that other stuff. So I'm like on like leave for that. So. Thanks. I'm almost big 5-0. Okay, shout out to you, but I'm going to start doing prerequisites for nursing. Nervous. Don't be scared of it. Don't be scared of it. I went to school with 50-year-olds. Yep. Exactly. So shout out to all the 100. I caught up on all the questions. I appreciate everybody asking me all the questions. I'll hang out here for like another 20, 30 minutes. What questions y'all got? Hey, like I said, I failed my NCLEX 3 times, y'all. 3, right? I say to myself, I'm unsuccessfully successful because I am. Nobody would ever fucking know that I failed my exam, ever, unless I actively told you. And I have no problem telling you that I was unsuccessful. That's exactly why I created my NCLEX courses, because I want to take people through the steps that I had to figure out for myself. So that way, you don't have to go through them. So I'm just saying. It says what to consider before getting into nursing school. You need to really consider your time management for sure. You really need to consider your time management, because once you start nursing school, that shit's not easy. Because you have to really get into a rhythm, and you gotta cancel people out. You really gotta cancel people out, and you gotta focus. So whatever life you thought that you had, it's about to be temporarily not. And you're gonna see who your real friends are when you start nursing school and then when you finish. Okay, so think about that. I failed once in November last year. I'm studying now. Shout out to you. Highest honor. That's what I'm saying. What was the hardest part of school? Time management. It was getting into a rhythm, because I was still working a full-time job. I was active duty. I was an actual instructor. I was a surgical tech instructor for 3.5 years. And I've been an instructor since 2015. So I've been teaching like really heavy for the last 8 years, almost 9. And so, to do that and then to go to nursing school, it's difficult. It's very difficult. Doable, but difficult nonetheless. Okay. What was the hardest part of nursing school for you? Brooklyn. I just stated that. I didn't even see your question there. It says C's make degrees. True. C's do get degrees, right? And here's another thing. Nursing school doesn't teach you how to be a nurse, y'all. Nursing school doesn't teach you how to pass NCLEX. Nursing school teaches you how to get through nursing school. Listen to me when I tell you that. I'm trying to tell you right now. You'll learn how to be a nurse once you get out there and you start working the floor. I'm telling you, because you're going to get out there. You're going to have imposter syndrome, all that shit. All that school cares about is getting you through, taking your money and getting you through. Actually, just taking your money. They don't give a fuck if you get through, but make sure you get through it. Don't worry. If you fail the NCLEX, just remember you don't have to go back to school. That's not necessarily true, Isabel. So certain places, like in Texas, you get 4 years to take it, right? You get 4 years to take it if you fail. If you fail after that 4 years, you have to go to the Board of Nursing, and then you have to, they'll either send you through a remediation program, or if you keep failing, they'll be like, all right, you can't do this. You have to go back to school. But that's drastic. I've never heard of nobody going through that, me personally. And I've coached tons of people and nobody's had to go through. I've coached somebody who's failed the NCLEX 10 times, right? And they didn't have to go through that. So just think about that. All right. I work as a caregiver now and I love it. I think nursing could still be something to consider. Yeah, you could do that for sure. Time management for sure. It helps you have an amazing support system. Time management, support system, accountability, understanding questions, being able to to take constructive criticism, and then also being able to stand up for yourself, right? I went a semester. Hardest part about the testing method. Many answers were right, but there's only one correct, right? Based off of the 4, right? Based off of the 4. I worked during nursing school too. I also had 2 kids. Time management is critical. Facts. It 100% is. Thank you for I got a finger, right? And I got the roses. Appreciate you. Highest honors. Currently teaching me how to read the book. Hey, that book will put you to sleep. Taking your money, that's it. Facts. That'll take that money. Trust and believe me, right? Hey, if you guys are new here, my name's Kevin. I'm a nurse. We're talking about nursing stuff. Ask your questions. Make sure you guys make sure you guys share, make sure you guys follow. I'm gonna hang out for about another 25 minutes or so. All right. It is crazy. It's crazy out here. Do we hold insulin in when patients are going to surgery? Please help. I see this question a lot. So it depends on what the patient's glucose is. And if they go in for surgery, it really just depends, because if their glucose is going down, that's going to be an anesthesia thing. Anesthesia is going to take care of them, right? Or if in pre-op, they're going to take care of that as well. You can't have a patient who has a low blood sugar or an even high blood sugar, like over 200, 250 or whatever. They can't be that way. Anesthesia will be like, nope, or give them insulin and let's see, or they'll hold them, so on and so forth. It all just depends on where they're at, right? I just finished my program today, NCLEX Next. Shout out to you. Congratulations. Hey, everyone. Currently studying for my NCLEX PN. Any tips? I feel like I don't know where to start. Very first thing that you need to do is you need to recreate the testing center, right? You need to sit here, have a computer, do whatever you need to do, right? Have you ever worked from home? I have worked from home and I absolutely love it. And that's actually my next goal. Next goal, work from home / do my course and do my coaching and stuff like that full time. Like I said, those would be the very first thing that you need to start. You need to get you a review. If you haven't been provided one with your school, that, in my opinion, provides you content as well as NCLEX style questions. That's my opinion, right? So I got one. It's for $48, but there's only content videos in there right now. There's 40. As a matter of fact, I have 42 content videos, y'all, inside of my course right now. So I'm just saying, you got to think about those content reviews, those reviews that are out there that can help for you. Mohammed said, hi, what's up? Can I study for 1 week and pass the NCLEX? I don't know. Roland, go try it and tell me. Let me know. Thank you for all the answers. Have a good night. Thank you, Bailey. I appreciate you being here. That insulin question is definitely a case-by-case basis for sure. It really, you need a little bit more context in order for you to answer that question correctly. Should I become a medical assistant before nursing school? You can become a medical assistant. You just ended. I actually ended probably about 10 minutes ago. Bubbles, thank you for the flowers of roses. I appreciate you. It says that VA, I'm an MA and currently in nursing school. I recommend it for sure. Anybody that wants to be a CNA or an MA, before you go to nursing school, so that way you can, it keeps you familiar. It helps you familiar with your surroundings of you seeing things and hearing things and, putting yourself in that environment that you're eventually going to be in, but of course with more responsibility. Okay. So, we used ATI. How do you feel about comprehensive book as a study source for the exam? I personally don't like, I didn't like ATI and I don't like HESI. I saw other programs out there like Mark Klimick, Kaplan, Hearst, NCLEX High Yield, what's some other ones? Remar, Archer, UWorld. They got a ton of them out there. But like I said, I can't sit here and read a book. If I see videos, I'm more of a visual learner. I'll sit here and I'll take notes on whatever that content subject is. I go to that subject in the book, or I would have had my PowerPoints, blah, 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 so on and so forth, right? Now, I have my opinions on UWorld. UWorld doesn't provide content. They give you questions and rationales. Their questions are good. I think their rationales are pretty good too. However, when I tell people to study, whether you think you believe it or not, get content, get the ones that have content, right? Which is why I'm a super huge content heavy guy. All right. I definitely feel more educated while in school because of being an MA first. Facts. Shout out to you, Allison. Hey, is it Heaven Ridge? Allison Heaven Ridge. I was going to say Haven Ridge, but I feel like that's not right. But shout out to y'all who are joining. My name is Kevin. I'm a nurse. You guys are asking me nursing questions. Make sure you guys like, share, follow. I do these lives Monday, Wednesday, Friday at 5:30 Central Standard Time. We go over NCLEX questions of some sort, and then we do an AMA. So you guys ask me questions. Like I said, I created an NCLEX course. It's for $48. It's right now in its pre-launch phase, which is why it is the price that it is. I do one-on-one NCLEX coaching as well. All those links are inside of my bio. If you guys have any questions about those, check those out. The link in the bio will take you to a link tree. Okay. So some people were just like, oh, I don't see it. I'm like, go click the link in the bio, my guy. Okay. And of course, like I said, follow and share all that information with somebody because you never know who's going to need it. Okay. Don't be selfish your whole life. I mean, you can be selfish sometimes, but don't be selfish your whole life. So what else y'all got? What other questions y'all got? Have you thought about going back to school? I have. For a long time, I didn't know what I wanted to do. If I wanted to do, for a long time, it was CRNA, and I was like, I don't want to do that. Then I wanted to do MP, didn't want to do that. Then it was between education and informatics, and then I decided to stick with education because I thoroughly enjoy teaching. I love doing these lives, love them. I love them. Even when people come on here and they start talking shit, so I can start talking shit back. Because what you gonna do? Fight me? The fuck? No, but yeah, I really do like teaching. Like I said, I was a surgical tech instructor for 3.5 years. Then I became a pre-hospital trauma life support instructor, tactical combat casualty care. I was an advanced burn instructor for a little bit. And now I'm a TNCC instructor, so a trauma nurse instructor. So So I teach those classes on the side when I get the time for that too. So, I enjoy that. I'm a registered vet tech, but want to get into nursing. Do you recommend an accelerator program? Well, animals are a lot different than people. So I'll just say that, Brenda. But if that's where your heart lies, why not? Right? It doesn't have to be accelerated. You could take traditional, but the accelerator programs are doable, right? The fastest accelerated RN program that I've seen is 12 months, and it's at Texas Tech University. And I know a few people that went through it, and it is a monster. But there's some other ones out there that are 15 months, that are 18 months. So it all just depends on you, right? But the biggest thing that you need to realize is when you start nursing school, whoever you thought was in your life is going to be gone. As a matter of fact, I saw one in a Facebook group yesterday where a girl said that her boyfriend of 9 years, she started her first semester of nursing school, y'all. Her boyfriend of 9 years has been cheating on her for the last 2 months. How ironic is that she started nursing school, right, 2 months ago, and he's been cheating on her for 2 months. Because what happens to your time when you become a nurse? And I'm just saying this because she said it, right? But I'm not saying it doesn't happen to people, to men, even though men is a very small minority, 89%. 89% women compared to, 11% men. You do that math. That's a lot. So, it's just like, how do you get through that? Time management, a support system, take that pain, turn it into fuel and push through it. And then the biggest FU or middle finger to somebody is, hey, check out this license and check out this degree. I did it without you. It says, but the manosphere said women should prioritize relationships while in school. Oh, yeah, no. When I hear that, I need people to go to therapy, and I need for them to figure out what their problem is for real. Like, there's a lot of things that were going to happen to me in nursing school. Luckily for me, it didn't happen until after nursing school because, everybody goes through their heartaches and their hardships while in nursing school, no matter how difficult, because we all go through shit. So I have failed NCLEX twice. Do you recommend, what do you recommend I should do? Need your help? Well, there's multiple ways that you can find yourself a review. You can find yourself a coach. I do one-on-one NCLEX coaching. You can look on YouTube. You can find all kinds of different stuff. But here's what I tell people that reach out to me for coaching is I don't know exactly what, like where you have a deficit at. Like, here, think about this. Do you have a content deficit? Like, is there content that you don't know? Do you understand NCLEX style questions, right? Do you understand how to apply NCLEX questions or how to apply the content to NCLEX questions, right? Do you understand how, the process of elimination, right? What was your support system like? How was your study habits? Like what else? Were you taking naps, right? What's your accountability look like? Some people come to me and they were just like, I'm not passing this exam. And I'm like, why? Well, I guess it's because, I don't study enough. And I turn around and I'll tell them, I was like, well, there's no I guess. It's because you're not studying a lot. Like, I don't coddle you. I won't coddle nobody. I don't coddle nobody. So if you can't come in to my coaching or even come to me correct to tell me what your issue is, how in the hell am I going to help you? And that's not me being directed towards you. That's just me being honest towards anything. How can I help you if you don't know what you messed up on, right? So that would be my recommendation. Like I said, I do a 15-minute free call, based off of like, hey, where you are all the time. Shay, I keep it 100 all the time. Like, and if you don't like me, that don't got shit to do with me. You not liking me don't got nothing to do with me. Right. And then what I tell people is like, I got my license. I fought hard for this motherfucker, yo. And I will always keep it. But what I try to tell people is like, you have to tell me what your issue is so I can better help, so I can better guide you. Because remember, I can't take the exam for you. I can't. Right. So here we go. Let me see what you said. I organized my notes on GoodNote 6. What is GoodNote 6? I don't even know what that is. Did you use Kaplan? If so, do you know about the decision tree? I did use Kaplan. And I loved Kaplan. And Kaplan for me is Kaplan and Mark Klimek were the two that worked for me 100%. Right. And when I teach, because I was already teaching before I even became a nurse, I have a mixture of my own teaching with the Kaplan's decision tree and the Mark Klimek, audios. Like, I have all three of those mixed, and I project those to people because it's all about the attitude and the knowledge and the stuff that I bring based off of the dynamics of how Kaplan breaks some things down and the simplicity of how Mark Klimek. I was like, man, I like that dude because he breaks shit down the same way I do. So what was the resume site you used again? I don't even know. What resume site Was it LinkedIn? I'm not sure. I work too many hours. Student loans are due every month. So I need to pass my RN. So you should be able to defer those. You should be able to defer student loans, like up for a while. Isabel said, I think the biggest issue is that people try to use too many tools to study. I agree. I always tell people you don't need to use anything. You don't need to use anything more than two. I've had so many people say, hey, I have Archer, I have UWorld, I have Hearst, and I have Simple Nursing. Bro, why? Why do you have so much? Because some of them are going to contradict each other. And then your head's going to be like, what? Like it's going to explode. And then you're going to be hindering on that. You're going to hold that. And then it's going to hinder you from progressing forward. Stick to one or two. No more than that. No more than that. I loved Mark Klimick because the audios were great while I was driving, podcast style. Wes says, I'll have to check into the second thing you said. Kaplan is great. I said Mark Klimick, yeah. For me so far, Shay said no. American graduating from the UK May 25. When should I start studying for my NCLEX? Wait, so you're an American, Aaron? You're in the UK right now? And you're studying for the NCLEX, or you're going to be studying the NCLEX, you should start studying for the NCLEX in your last semester, like here and there. But then when you're about like a month, or I would say anything like a month before you graduate, or maybe I'll say 2 months, a month or 2 months before you graduate is when it needs to be heavy. It needs to be heavy. I like Simple Nursing on YouTube for sure. I liked his pharmacology. That's honestly how I remember specific things. It says unapologetic. I'm not sure where at now. It's been 5 years, but I'm willing to give it a shot again. Where should I start? What are you talking about? Like it's been 5 years since you've taken your exam. So you think only Archer Review should be enough to pass NCLEX? Not what I said. I think Archer Review is great because they give you questions and they give you content as well. But here's the reality of it. Is some people are just like, what's a good review? A review is only as good as the amount of work that you put into it, right? I think Kaplan works, right? But there's so many people that have failed on it. I think Archer works. I think UWorld works. Myself, I failed with UWorld, but it works. I coach people off of those questions. I coach people off of Archer. I coach people off of Kaplan. The questions I think are great, but it's all about how you apply it and how you retain the information. I promise you. And Aaron said, yes. Okay, I got you. So you say you're applying. Okay, I already answered your question. If y'all only knew how different UK versus US nursing is. Aaron, enlighten us. Let me. You would be the first person to tell us about, how it is going to nursing school in the UK. How did you end up in the UK going to nursing school being from here, unless you applied to go there and you kind of did it on purpose? I'm curious. Let us know. Do you provide tutoring for nursing classes like fundamentals? I don't. I only specifically do coaching for the NCLEX, and it's one-on-one. However, coming down the pipeline, I'm going to be doing group coaching, and a lot of people ask for being in group coaching when it comes to things in nursing school. But here's one thing I'll tell you since you're in nursing school: get into a group of people, yourself and 3 other people. Okay, listen to me when I'm telling you this. I'm giving you game. All right, I'm giving you game right now. Pay attention. You, 3 other people, for whatever test that you guys are doing, split it up 25%. You do 25, they do the other 25, they do the other 75. So 25 apiece. You do 25% of the work. Listen to me, 25% of the work, and you reap 100% of the benefits. So you do 25, they do the other 75, then you put them all together. Put it together in a Google Doc. You hear me? Put it together in a Google Doc, and then you go through all the important shit that's there. And you have the whole thing that you're studying for your exam, right? So if you're talking about, yes, that I'm telling you, and get into a study group that's going to challenge you. Don't get into a study group where fucking people are talking about Taylor Swift and fucking Travis Kelce. No one fucking cares about that, all right? No one cares. I'm telling you right now. It says, I've done that before and my other partners had wrong and incorrect information. Well, that's how you know you need to find a different group. I didn't say stay with that group. If you find a group that's giving you wrong information, when you get the information from the book, obviously motherfuckers are trying to take advantage. I didn't say stay with them if they're giving you wrong information. Luckily for me, I did that same exact thing, but I didn't do it until MedSearch. And I'm telling you, it was a godsend. If y'all go to my Instagram and y'all scroll down, you'll see the picture with me and 3 other ladies, right? Those 3 ladies, we were together. We were attached at the hip when it came to doing notes and all that stuff for for nursing school. And if it wasn't for them, I wouldn't have graduated. I guarantee you, because we all fed off of each other every single time. And now we're also really good friends. So think about that. But study groups are the key. All hands on in wards. Oh, okay, I got you. 0 lectures, online tests are open book, no cumulative test. Stop it, Aaron. Are you trying to tell us that everybody should go to the UK to fucking become a nurse? Because to me, that makes tons of sense. That makes tons of sense, right? That's exactly what we do for sure. Incorrect, thank you. I will try to do that. So I feel like I'll be underprepared for the NCLEX. I see that. So here's the thing. It's just like in nursing school, they don't necessarily prepare you for the NCLEX either. They say they do, but they don't. Because guess what? In nursing school, they tell you what? You're a self-learner. I give you this thick-ass book. Go figure it out, right? And then hopefully you pass the test. Right? And is it Shayna? Or I'm sorry if I'm saying your name wrong. Is it Shania? Shania. I'm going to say Shania. I think that's what it is, right? So the thing about it is like, if one group doesn't work, of course, like I said, go find you another group. Just because that one group, it's not the end all be all. Go find people who really trying to get out of here, right? Yes, we should study for 2 hours, then have lunch break, chit chat, then right back to it. Yeah, do that. Chit chat when you're not studying. But when you are studying, it's all business. I'm sorry, but you can't do things on your own you can't. That's the thing. Get into the teamwork dynamic of nursing school now. Because when you get out here to this floor, you're not an individual. You know, you're always going to, trust and believe me, you're going to be on that floor and somebody's going to shit themselves with a cold brown and you're going to wish, help me. That's what you're going to want. So get into the team dynamic now. Trust and believe me. Starting nursing school in the U.S. couldn't pass. I applied abroad and switched it up. It's only 3 years for BSN. Shout out to you. They don't. How did you learn how to chart? Practice. Study Kaplan for NCLEX. Some people don't like Kaplan. It doesn't work for Kaplan. However, I loved Kaplan. I thought it was great. That's crazy. I'm so what? I don't know what you said, Isabel. You learn to be a nurse when you start working. Facts. We each did 25% and got together and taught our portion. The best way for you to learn is to teach somebody else. I learned a lot about maternity. Like, trust me, your boy don't know nothing about preeclampsia, the Apgar score, and I'm in a room full of women who had babies. And they were teaching me about everything. And then when I got through labor and delivery and maternity, smooth sailing. It was awesome. Shania. Pronounced like Shania. I'm going to fuck it up, and I'm sorry. I don't mean to do it on purpose, you know. But, yeah. So, yeah, that would be my take on that. That would be my take. And it's $17K a year for you to go to school in the UK. So here's the best thing is I wish that those things could be merged together, as in like, you know, not all these lectures, not all this BS. It's a lot of hands-on learning and, you know, this open book. But then, you know, you still get the lectures, you know, the didactic portion. Shania. Oh, no, pronounced like Shania. Oh, OK, I got you. Shania. My bad. My bad, but I got you. I'm tracking. I'm picking up what you're putting down. Hey, shout out to everybody that's joining. My name is Kevin. I'm a nurse. We're going over nursing stuff. This is Ask Me Anything. I'm going to hang out for about another 5 minutes. I appreciate everybody. I do nursing, we do nursing conversations. I also do NCLEX questions at the beginning of every live. I do my lives Monday, Wednesdays, and Fridays at 5:30 Central Standard Time here in the U.S. for somebody like Aaron, who is over in the United Kingdom. Yeah, and we do that. I created an NCLEX course. It's the 7-day NCLEX course. It's for $48 right now for a lifetime. Hey, I'm telling you right now, today's prices aren't tomorrow's prices, so you better get it for yourself. It's in its pre-launch phase right now. So what I'm trying to tell y'all is that I have an NCLEX review that I'm currently recording. Not right now, but the camera's right here, and that recording is going to happen. New NGN as well as NCLEX style questions are coming down the pipeline. So here within the next couple of weeks to next 2-3 months, all that stuff's going to be in there. So make sure you guys go check out that, especially for those that are graduating in like 6 months to a year. It'll be perfect for y'all because it'll be done by then. All right. So make sure you guys check that out. Rachel, are you an RN nurse? I'm sorry. Are you an OR nurse or did I make that up? Nope. I'm very much an OR nurse. I feel like, Rachel, you've asked me that before. But real quick, hey, for the last 4 minutes that I got in here, I want to know who you are, where you're from, where you're at in your nursing journey. Let me know. Let's spark up a conversation. What questions do you have about, you know, working as a nurse or, you know, nursing school? NCLEX. I'm like the NCLEX freaking I don't know, guru, I guess now at this point, whatever. So, Bet, are you going to the ARN event in Tennessee next year? I don't know. Is that an invitation? Are you inviting me there? Like, what are we talking about, Rachel? Oh my God. They actually had the ARN conference here in San Antonio this past year, but I didn't go to it because it was my son's birthday. So I didn't go to it. Actually thinking about going. It's during my, go to it. Go to it for sure. I would definitely go to it. And what are some things that I'm working on? I'm thinking about being a vendor at some of these conferences. So, me talking about my NCLEX course and all that good stuff, to try to get that out there specifically for nursing students, that are going to eventually get to that exam. So I would recommend thoroughly going to it because you learn so much from it. Oh, it's going to happen. Best believe it's going to happen. Isabel said, I've been a nurse for 5 years. I'm an infusion nurse and 2 classes away from getting my BSN. Shout out to you, Isabel. Shout out to you. And you're an infusion nurse, ma'am. You should just open up your own infusion therapy business. You know what I'm saying? Get out here and make this money. You know what I'm saying? Because these people got this money. Is it Bayada? Did I say that right? Oh, Bayada has a residency program for home care. They came to my school. Have you heard about it? I have not. Please educate us on that. Arkansas graduate December for your PN. Shout out to you, Melissa. Shout out to you. What else y'all got for me? What else y'all got? I don't know if y'all can see this gray hair up here, but I thought it was like lint. It's not. It's just gray hair. It's just life that's just really messing with me right now. You know what I'm saying? So, and of course, I got this fancy light that's right here. You know what I'm saying? So I got to kind of turn that down because the color be. I'm from Kansas. Got accepted from nursing school and starting soon. Shout out to you. Is it Razan? So shout out to you. Get through nursing school, y'all. Y'all can get through it. Trust and believe me. Hey, remember, I am this is my testimony. I failed NCLEX 3 times. On my 3rd time, I thought I was a failure. I thought I didn't belong. I thought that, I wasn't worthy of being a nurse. And then when I came out here and be a nurse, I realized that it's not what the commercials make it crack up to be. Don't get me wrong. I love doing patient care and taking care of patients for sure. But everybody, you're worthy. You just got to put in the work and you got to do what you need to do to get there. You really got to do what you got to do to get there. I got a mentor, he guided me, told me that I was messing up. He told me in a very profound way that, hey, you're fucking up and you need to fix yourself. And then I was like, how? And then he was just like, well, let's talk about it. And then I was guided. And the same way he guided me, it's the same exact way I guide others. So any advice on someone failed their NCLEX the first time and scared to retake it? If you're scared, go to church. I'm going to tell you right now. So if you're scared to retake it, I don't know why. So if you're scared to retake it, I can tell you right now that exam don't care nothing about you being scared of it at all. So that's right, Rachel, you did say that you were going to go that route. I remember now. But the one thing I'll say is don't be scared of it. You just need to get your breakdown, see why you didn't do so well, and then adjust accordingly. Think about it about titrating drips. You're gonna find that rhythm, and then it's just gonna work for you. Okay, that's what you have to do. I'm waiting on my approval. It'll be here soon. Trust and believe me, it'll be here before you know it. I'm just starting out my prereqs. What's your biggest advice for someone in the beginning? Start to get your time management under control, Jade. That's what I would tell you. I watched an open spine surgery a few weeks ago, and I was like, yep, RNFN. Hey, Rachel, think about it. You could be you could go all the way and be a surgical nurse practitioner and be, essentially the assistant to the surgeon doing all that and work with a group. Think about that. I don't want to fail again, waiting for my ATT again. Is it? I don't even know how to pronounce your name. Is it Zeraris? Zeraris. That's actually a nice name. I'm probably fucking it up, but it's okay. If you're scared, go to church. Look, I'm letting you know. Do you use ATI? I do not. Jade, thank you for the rose. Sarah says, I have taken 3 times and completely feel like I'm not meant to be a nurse. Hey, so I've taken it 3 times and I thought the same thing. So now we need to go back. And we need to go down the list. So how is your studying habits? What's your support system look like? Do you understand content? Do you understand NCLEX style questions? Do you understand what they're truly asking you, Sarah? And Zeraris? Do you understand that? Right? What's your support system look like? What's your time management look like? Do you have a study plan? What's the hardest part for you? Is it pharmacology, management of care? Do you know how to turn around and actually hey, I'm going to study these things first? Did you do at least 85 questions? Did you do at least 85 questions every day or every other day? Did you do that? You have to go through and audit your life. It's yours, not mine. You have to go through and audit your life to see where you have those deficits. And when I do my coaching, that's what I go through with people. And I actually go through breaking down NCLEX style questions. But there's a lot of stuff that's going to be coming down the line for y'all. So y'all be able to see that. I'm in my last semester of BSN. Any advice for the exit exam? Definitely look at that Saunders book. Or definitely look at, like, what is it? Management of care, pharmacology. It's all about the critical thinking and the clinical judgment, right? Because they're preparing you to get out, to graduate and to go out there and work as a nurse, right? Best advice I got is to start at a community college, get your associates there, barely any debt. I agree. I didn't have to pay anything for my degree. I've been in the Navy for 16 years, so I got the GI Bill. And by the way, the GI Bill is not free. You have to pay for it with money and with your body and with your fucking mental capacity. Trust me, that shit is not free when I tell you that. Okay, so I don't have any debt for me to go to school. I actually still have 18 months left on my GI Bill for where I can go and get my master's and then roll that over. There's those benefits that are there. But trust and believe me when I tell you pay for it. But who is it? Isabel, I agree with you 100%. Start at the community college, right? Where it's not going to break your pocket. However, these community colleges are getting flooded with nurses, right? Some of them are on some of these schools are on 3-year back order, if you think about it, right? Isabel said, thank you for your service. I appreciate your support. Thank you. So you got to think about that. Okay. And then get out there and start working as a nurse with your associate's degree. And then start taking online classes one at a time at your leisure. Then get that bachelor's and then do the same thing when you do your master's. Right? But guess what? You would have already gotten 2 years of work experience over somebody with a BSN. If anybody comes to you and they talk shit to you about, I'm a bachelor's level degree nurse, you're just an ADN. Hey, I'm gonna tell you right now, don't put your hands on that person because I know you're gonna really want to. But yeah. Don't people that do shit like that are like, I'm a master's degree and I'm this and I'm that, shut up. Don't forget, once you get these degrees, y'all, don't forget where you come from. All right. And that's what a lot of people forget. They forget where they came from. It costs nothing to be kind to somebody. All right. And it costs nothing for you to remember where you came from. All right. So, but all right, y'all, I appreciate AK. I appreciate the rose. I think I answered pretty much everybody's question. We had 64 people that were still rocking in here. We got 23,000 likes. So I appreciate y'all. I appreciate all the gifts. I think this is the most gifts I think I've gotten ever. And I've been doing TikTok lives for 8 months or something like that. So we will be doing this again on Wednesday at 5:30 Central Standard Time. So Aaron, if you're still here, I think y'all are 5 or 6 hours ahead or something like that. So make sure you guys are here for that. Make sure you guys follow. Make sure you guys share when we do these things or when I do these things, because I do these. I tell you, I really do love doing these. I really do love doing these lives. And of course, make sure you guys go over there, follow, check out all the TikToks that I got over there. I be pissing people off in the nursing world and no part of me cares. But I be trying to keep it a buck, $1.50, keeping it a stack, as the kids say. But a couple of, outgoing things for you guys. If you have anything going on, mentally for yourself, go talk to somebody. If you got anxiety, go talk to somebody. Be kind to yourself. Okay. It says, thank you for doing these lives. Hey, yeah, no problem. Be kind to yourself. There's only one you, right? You have to be able to take care of yourself, or you can't take care of anybody else. I don't give a fuck what they tell you. Remember, you're becoming a nurse because you want to become a nurse. You want to become a nurse so you can take care of other people. Right, to include your family, right? Because if you don't take care of yourself, you're no good to no spouse. You're no good to those damn kids. Because fuck them kids. I'm just playing. I love my kids. They all right. No, but seriously, take care of yourself, all right? Because I can tell you right now, these hospitals will run you into the fucking dirt, all right? And the only person that's going to care about you is you. I'm dead ass. I feel like I'm on remember where Jerry Springer used to do his final thoughts? I feel like I'm there. Take care of yourself and each other. I'm not gonna say that, but RIP to Jerry Springer. But but seriously, take care of yourself mentally. All right, don't be scared. All right, if you're scared, #go to church, Jesse. Don't be scared of it. All right, don't be scared of nothing. All right, because you can get through this life, you can get through this nursing, you can get through these work, you can get through these jobs, you can get through all that shit. I promise you. All right. But that's my final thing for you guys. Take care of yourself, or else you can't take care of nobody else. I promise you that. Last bit, I do one-on-one coaching for NCLEX. Check that out. That link is in my bio. And I also have an NCLEX course that's in this pre-launch phase. You won't find an NCLEX course anywhere that's $48. I promise you that. And if you get it right now, you get it forever. So I'm already working on, there's going to be probably about 7 or 8 videos that are going to be popping up in the next week or so, specifically going towards the new generation NCLEX. So make sure you guys check that out. All right. So I've been on here long enough running my mouth. I hope everybody has a great week. And I will see everybody on Wednesday. Yeah, Wednesday at 5:30. So you guys take care. Bye.